Hey, hello, everyone. This is Dr. Garrett Smith, also known as the Nutrition Detective around these here YouTube parts. And boy, after last week and the nickel toxicity episode, I think I have to tell you guys that I have learned, as you're going to see in the documents I have today, I've learned a lot from the research, and I have to tell you guys something right now. For those of you who watched last week's episode and you decided you were going to go and jump in and go and do all your research and you were going to go low nickel, okay? You're probably detoxing it really, really hard right now. If you're doing things right, you're probably not feeling good because our love your liver type people, we have a lot of the nutrients we already need to do this, and our bodies are kind of primed for detox. And all we had to do, we've had people just take oats out of their diet. That's all they did. It's the only change they made to their diet, and they replaced it with other starches. And within 2-3 days, they're detoxing. They got skin symptoms, they got brain symptoms, they got gut symptoms, they got farting and burping, and like this nickel thing runs deep. Kelsey's got symptoms. I had symptoms. I'm coming out of it because, just so you guys, I'm like, I think I started this about March 30th and we're about April 14th now. So I'm 2 weeks in, or maybe I started the 26th, something like the 26th. So maybe I'm 2.5 weeks in and I'm out of the woods of the main detox. I don't think she'll mind me saying this. Beth Martins was having some pretty rough detox stuff. I talked to other people in my office hours who started doing it, and they started having some pretty rough detox stuff. And folks, some people out there, the haters, are going to say that, oh, it's like nutrient deficiency. I'm sorry. You guys need to use your teeny little brains and realize that nutrient deficiencies don't come about in 2 or 3 days. Seriously. They're just grasping at straws. Anyway. So if you decided to jump in on a low nickel diet, and within about 2 or 3 days, you started noticing symptoms, and they may still be going on quite strongly, actually, you are dumping nickel. So I wanted to say I had assumed, I had told some people in the office hours and in the inner circle, and maybe, I don't know, in that last episode, that my initial impression from my research was that nickel didn't really have a detox dump. Maybe it's that way for normies who are just doing low nickel and that's the only thing they're doing. However, we are using synergistic multiple approaches to both nutrient restoration and detox. And our people, I mean, literally, folks, people are probably reducing their nickel by we're going to go over this. They're reducing their nickel by 100 micrograms a day. Up to 200 micrograms a day, most likely 100 to 200 micrograms a day of reduction of nickel in their cake hole. And they're starting these detox dumps. I had them. What were my symptoms? I had some little flare-ups. I was having some anxiety cycles. I was having some depression cycles. I was feeling like my space weather symptoms were getting worse. I was my appetite was less. I had burping. I had farting. I had like all that. And I was going, what is, and then I finally thought, okay, this is probably nickel detox. And my assumption was it's going to pass. And I started doing some other things. We're going to go over the supplements today that can help with this. I started making sure I got my soluble fiber since I'm not getting from foods. I started doing the normal things that I always do, the zeolite and the charcoal and the niacin and the MSG and all that stuff. And when I started really focusing on it, partially time had passed, but also when I started taking my supplements more regularly and more focused, things started to get better. So my buddy Edis is still going through it. He started a couple days later than me, and I think he's more toxic than I am. So I think it's going to take him a little bit longer to get out of it. But we started to see this is very real. So let's go into the first thing. So I have there's a references folder link because I have so many documents today to go over that I wanted to put them in different ones so people could keep them straight. And also I'm going to put them in the Love Your Liver so people have them there. So Joe just put up that link. It's also in the live chat. It's also in the info box below. So, and Joe will probably pin it as a comment when we're done. So let's go into this. So we're going to hit on the symptoms of, in the research and anecdotes of nickel toxicity. So Joe, I want to share that. There we go. Okay. So, oh, sorry. Let me make this. Let's do the full view. There we go. And we'll zoom in. Okay. The symptoms most commonly associated with nickel toxicity. There's well-known ones and then there's less known ones. Okay. Here's what I added that I just went over. Early nickel detox dumping symptoms may start within 2 to 3 days of starting a low nickel diet. So if you really started it well, you probably know what I'm talking about. And if they're present, they may last for 2 to 4 weeks. These can be quite strong. The stronger your detox dumping symptoms are, a greater level of nickel toxicity issue should be assumed. Here's the most prominent symptoms. So skin is the conventionally mainstream, most accepted nickel toxicity, nickel allergy area, okay? Chronic eczema and dermatitis. So most commonly hands, face, eyelids, neck, flexural areas. So flexural areas means inside of the elbows, behind the knees, armpits, anywhere where you're bending your skin, groin, under the breast, creases of the neck, wrists, and ankles. If you have eczema that has not gotten better on a low vitamin A diet and you've been getting your zinc, you probably have a nickel toxicity issue. Okay. Itching, dry, cracked, or scaling skin. We had one gentleman, he stopped his oats. Within days, he's got dry, cracked, scaling, even or dry and cracked and even bleeding skin within 2 or 3 days. And he got back on the oats and it all went away. He shut down the detox. Okay. You can do that too. We're going to talk about that. So rash flares and dyshydrotic eczema. If you have dyshydrotic eczema, that is almost a calling card for nickel toxicity. Okay. GI symptoms. Bloating, abdominal pain or cramping, diarrhea or constipation, or alternating. So if you're constipated or you have diarrhea, the nickel could be behind either of them. Nausea, reflux, and heartburn, irritable bowel type symptoms. Okay. If you have reflux or GERD, you pretty much have nickel toxicity. Okay. The nausea, multiple people have told me that they have lost a fair amount of their appetite when they started the low nickel diet. Not because the food's bad, they just don't want to eat as much because their gut is inflamed from all this nickel coming out. I want you to think about this. When you eat nickel in the diet, the conventional statements say you don't absorb very much of it from your food. Okay, so when people are taking in literally less than 200 micrograms a day of nickel in their diet, and they're saying you don't absorb very much from your food, and most of it you poop out. Just how toxic is that nickel then when you actually absorb it? Think about that. And then what are the cells that when you eat nickel, what are the cells that are 100% exposed to nickel? Your gut cells. So if any cells were going to soak up nickel and accumulate it, it would be your gut cells. So where is it going to come out from? Your gut cells. What's it then going to re-irritate? Your gut. Okay. Neurological or general symptoms. We have chronic fatigue. Nobody's got that. Brain fog, headaches or migraines, irritability or mood changes. We've seen anxiety and we've seen depression. We've seen some minor like wooziness, balance issues. Yeah. Systemic and inflammatory stuff. Joint pain or muscle aches. Some people, nickel can just make you hurt all over. The generalized inflammation feeling. That's what we're talking about. And then swelling is occasional. Respiratory stuff. Oh, the nickel cough. For those of you who have been going through all of this with us, especially you ladies, where you get like what you think is a cold, but it's not really a cold. You don't tend to get the mucus and the phlegm and all the other symptoms of a cold. You just get this cough. I know a bunch of you know exactly what I'm talking about. I am positive that that is nickel. One of the first detox symptoms I had, I think a couple days into it, was I would lay down. I think I told you this in this last episode. I laid down First night, I had a really rough cough when I went to bed. Second night, cough was about 50% of that. Third night, cough was about 25% of that, and then it went away. I don't think my nickel toxicity was as bad as, like, let's say you ladies out there, particularly you ladies, who are getting this cough that lasts a month. And you guys know what I'm talking about. If you've had it, you know what I'm talking about. So that cough was, for me, I think, one of my nickel detox symptoms. So there's nasal congestion, post-nasal drip, sinus-like symptoms, but there's also the cough. And I went over that in the lung section of the top 10 toxicity symptoms of nickel and the causes of death episode. Heart, cardiovascular, autonomic. We have palpitations, lightheadedness. So that I just talked about that wooziness that my buddy had. Key patterns that suggest nickel toxicity. So if you have ever reacted to cheap jewelry, or guys, if you reacted to a watch or a belt buckle, your immune system is primed for nickel toxicity. So part of nickel toxicity is the amount you suck up, but you may or may not have an allergic reaction to it. If you're allergic to it, it's going to be even worse. Okay. If you have symptoms that worsen after eating high nickel foods, chocolate, nuts, beans, seeds, whole grains. Obviously, we used a lot. We used a lot of these. We're still going to use them in the program. We got to figure out this nickel thing. So if you guys think I have all the answers right now, I don't. However, I'm sure that the people who undergo this with us and do it right and carefully are going to be so much better off than they were even just doing the normal love your liver diet. Okay. But what you may have thought, what I may have thought, what you may have thought was a reaction to too much soluble fiber very well could have simply been you just ate too many high nickel, high soluble fiber foods. And it wasn't the soluble fiber that was irritating you. It was the nickel. We just don't know yet. We're still figuring that out. Your skin issues persist even without direct nickel metal contact. Yeah. So if you used to, let's say you had earrings that caused you those crusty ears, ladies, and you got them out, but yet you still have skin issues there, or you have skin issues other places that started then, and they're not getting better even when you took away the metal transdermal source. Multi-system symptoms that seem unrelated but flare up together. How many of people in our program is this? Again, folks, some of what we thought may have been bile dumping symptoms may simply be you getting a lot of nickel at once. Okay. And if you've ever tested positive to nickel reactivity tests in the past, you're nickel toxic. If you've never done a low nickel diet to kind of undo or unravel the nickel toxicity, it's likely still going to be there and probably has only gotten worse. A study I'm going to go over later shows that as we age, the two biggest factors, this is crazy, in the urine nickel content in people. Number one was age. Wow, they got older and they got more nickel toxic. So they got older and they were peeing out more nickel. They weren't getting better from peeing out more nickel. They were getting worse as they peed out more nickel. And the second thing in the study was they said supplements. Do you know that in most of these nickel studies are coming out of Europe? You know, in Europe, they actually literally add nickel to some supplements. They add nickel sulfate to quite a few supplements. I can't believe that. I don't know what these people are thinking and why they're taking it, but they said the two biggest things that increased the nickel in the urine was age and supplements. And they literally supplement nickel. I had to keep checking on that because I'd never heard of nickel being sold in a supplement in the US, but apparently it's a regular thing in Europe. So let's move on. The factors that increase, factors or history stuff that increases the likelihood that you are experiencing a nickel issue. Now, I want you to pay attention here. So the low nickel diet, if should you choose to do it, you will get less sensitive to nickel. Funny thing, crazy thing, like we have people go low vitamin A and then they eventually get to the point where they can tolerate more vitamin A than they used to. You do the same thing with nickel. You can tolerate more nickel than you used to. Crazy that the two biggest things I'm going to tell you that cause leaky gut, retinoic acid, vitamin A, and nickel. Okay. So as we fix these things, as we seal up your gut, the thing we were missing previously was nickel. And we already figured out the vitamin A one, but as we seal up your gut, the toxic bile stops leaking in so much and you just don't feel as bad. And the bile is going out of you more. Okay. So these are the factors. If you have one or more of these factors, it's worth looking into. So if you are a female, you guys have heard me. This is known in the literature. They're much more common in women with nickel issues. It's consistently shown 2 to 4 times more nickel allergy in women than in men. And ladies, as we've talked about, you guys are kind of doing it to yourselves in certain ways. It's the jewelry and the earrings that you got when you were like, I don't know, 4 years old that you've been wearing your entire life. Cosmetics have nickel in them. And then women do just tend to eat more plant-based stuff than men. Inherently, folks, nickel mainly, other than fish and shellfish, nickel is mainly a plant food thing. Okay. Our fertilizers that we're using on plants, there's no nickel added to fertilizers, but fertilizers are commonly contaminated with nickel. And I want you to understand here, everybody's going, well, what are we supposed to eat? What's going on? Why did people used to be able to eat this? And why can't I just eat what my grandpa ate and be fine? They literally, I forget that Rothschild document that's been going around on some of the Instagram posts or other social media, but their goal is the covenant. Their goal is literally to poison us. That's their goal. Oh, there's nickel in fertilizers now that's contaminating it? What a coincidence. Sewage sludge as fertilizer? Give me a break. Like using copper sulfate as a pesticide on organic crops. They're after us. It's not paranoia. This is real. Okay. So ear piercings. So we just talked about that. The biggest single risk factor for nickel allergy, if you want to call it that, is ear piercing at a young age. Strong association between the number of piercings and the nickel allergy prevalence. So those belly button rings, ladies, other things, multiple piercings in the ear, other stuff. So this is just, you know how we make the best magnesium lotion on the market and you absorb magnesium really well through your skin? Well, just imagine if you put nickel or copper bracelet or other things on your skin. You absorb whatever you put on your skin, including metals. So a common pattern that has been noted, pierced ears leads to eczema, leads to later systemic symptoms. If you ever had those crusty ear piercing holes that wouldn't get better while you still wore the earrings, that's nickel toxicity. Okay, chronic contact exposure to nickel-containing items. So we got orthodontics, as in braces, and retainers. If you have a permanent retainer in, you probably want to get it taken off. It's not, if you've had it in for years, it's done what it's going to do. Like, unless you want to wear a nickel-containing wire the rest of your life, get it out. I am so excited to get I ended up getting my son braces a year or something ago. You know, ex-wife stuff, whatever. But I'm so excited to get those off of him. I cannot wait. I can't believe all the stuff that came out with the Revive and the collapsing skull and now the nickel. And I'm just going, braces are medieval. And I'm never going to really recommend them again, especially the metal ones. Not that I ever recommended them. Oh, by the way, I've been using my big, the XL R3, the Revive XL R3. And boy, that's a big boy, but, I'm over the initial hump and I'm really excited for what it's going to do for me. So we already talked about this. Reactions to jewelry are an issue. Surgical implants made of stainless steel, which is 10 to 14% nickel. So that's more than your stainless steel pots and pans. they only go up to like 10% nickel. So if it's 14% nickel, that's even more. Maybe if they're cobalt or chromium based, folks, if you have something stainless steel in you, screws, wires, whatever. If you cannot get it removed, I mean, I had one woman come to me. This was a long time ago. She had elbow surgery, and you could literally see the screw head like kind of poking through her elbow skin. And she said her elbow was never getting better, and she had other systemic symptoms. And she was like, I think I should just go get it out. And I was like, I think you should just go get it out. And she got it out. And then the systemic symptoms went away, and so did the elbow pain. Kelsey's daughter, a while ago, got a stainless steel cap or crown. I'm not familiar with which term it was. And she said immediately, within weeks, she started getting stuffy and snotty. And now she's got they were thinking of getting her tonsils and her adenoids out, and she has breathing stuff. And now Kelsey's looking back and going, everything started after that. Okay. If you can't get it out, all I can tell you is you better do as much for your health in every other way possible. I don't know. There's even stuff, I'm not going to go over the dental stuff today, but it shows that Streptococcus mutans, the same bacteria that's associated with cavities, with braces in, that bacteria actually eats away at the braces and then frees up more nickel in your mouth. There's a plan, folks, and it's not for your benefit. Okay, so again, just more nickel sources: watches, belt buckles, buttons or zippers if they're metal, phones and laptops if they're touching your skin and they have a stainless steel part that's touching you. Okay, if you have a history of unresponsive skin issues, as in, let's say you've done all sorts of medications, you've done all sorts of topicals, whether medical or whether pharmaceutical or natural, you've done diets, even like Love Your Liver, stuff like that. You've done all this stuff and it never responds. You probably have a nickel issue. So eczema of any type, especially dyshydrotic, atopic dermatitis, that's allergic, contact dermatitis, sensitive skin in general. So if you just tend to have dry skin, I can tell you that the little bit of dry skin that I had and that my son also has, mine has gotten better. I'm still working on getting my son rid of those braces and then teaching him more about a low nickel diet. Jobs with a higher risk. Metal workers, including jewelry makers, hairdressers, cashiers, as in handling coins. I actually saw an article the other day about how they were, with the euro, they were talking about people getting more nickel exposure from the coins. And if you're in construction or machinery or machining, I think that meant to say, history of high dietary nickel exposure. This is where I'm taking responsibility. Veganism or vegetarianism. Now, for those out there who are doing the Love Your Liver approach, and you're trying to do it mostly vegetarian, or I don't know how you're going to do it vegan. If you're doing either of those diets, there's been some large long-term studies coming out showing that vegetarians and vegans have worse mental health over their lifetime. Well, if you are eating a vegan or vegetarian diet, you are getting tons of copper, you are getting tons of manganese, and you're getting tons of nickel. And there is no way around that. I don't know what to tell you. I'm not saying we have to eat all meat, but we do know that people can live. The all muscle meat carnivores are showing us that you can live on just meat, and that we need to be much more careful with our plant food selections, especially when they're growing them and spraying them with toxic stuff, probably on purpose. Chocolate or cocoa or cacao, folks, this is the highest nickel thing out there pretty much that normal people consume. Stop it. If you have issues that are not going away and you've been doing Love Your Liver or anything else and you just cannot stop eating chocolate, that's a huge part of the problems. Diets high in whole grains, legumes, or nuts and seeds. Yes, for some of us, what you're gonna realize is that when you see the supplements part of this, and you look at the rest of the diet that we do, other than the beans and the whole grains mainly, was low nickel. So we did reduce the nickel in a lot of places in the diet. However, we had this, but then we also had the supplements we tend to use, which, as you'll see, are protective against nickel as well. So we were kind of pushing both buttons. You know, we were kind of like bringing in more nickel with some of the high soluble fiber foods, but we were also putting in a lot of low nickel foods and using supplements that helped to work against the nickel. Yeah, so a common pattern would be a plant-heavy diet leading to worsening unexplained symptoms. And if you've ever, we've had a couple people post comments about how they unintentionally did a low nickel diet. Well, if you've ever unintentionally or intentionally gone on a low nickel diet, like all muscle meat carnivore, or if you did a lot of meat and white rice, or meat and some other low, meat and apples, or meat and bananas, or you did some other low nickel diet for a while and you got better, then it's quite likely that nickel's part of that. Oh, here's some interesting stuff. I thought, because some people are starting to say that, maybe vitamin A is not as bad as we thought. And I'm warming to the idea that we may, for those of you who don't know out there, I was never the person who was trying to get to zero vitamin A in the diet. That was other people. And I never understood why they were trying to do that. I don't get obsessive about that. In the Love Your Liver program, I still said, for you to stay on this diet, if you felt it was necessary for you to have like up to 2 tablespoons of butter a day, you could. Now, am I saying that's okay for everybody? No. I'm saying if you were going to stay on the program, if you had that versus quit, then have it. Okay. Perfection is the enemy of good enough. But what do I think is going on here? I think vitamin A and nickel and copper and iron overload are all synergistic in the problems that they lead to. So we have these papers here. Let me go to the first one. Wait, let me make this a little bigger. There we go. Novel nickel contact dermatitis in a patient taking isotretinoin, Accutane. So I want you guys to understand, could you have gotten vitamin A toxic and then caused a nickel problem, and now the nickel problem is what's continuing your problems? Do you understand? There are many, many reports about contact dermatitis to nickel. So now people are reacting to like their nickel jewelry and their nickel earrings and their nickel watches and their nickel belt buckles and side effects of isotretinoin. So they're saying there's both of these things exist: nickel reactions and Accutane problems. But the development of contact dermatitis to a previously tolerated allergen while taking isotretinoin is not well described. We report the case of a 19-year-old man who developed a new nickel allergy during isotretinoin treatment, during Accutane treatment. If you're allergic to something, folks, vitamin A toxicity is part of it. So vitamin A toxicity can make it slows your detox. It makes you toxic. It makes everything work less. It's literally a chemical peel to your gut. So then you start adding nickel, which is also a leaky gut causer, and they work together, and then people develop allergies. Okay. So now let's go to the next one. Allergic contact dermatitis to nickel. Can systemic isotretinoin therapy promote sensitization? Here's the full paper. Let's go to the full paper. This is the same paper. Just so you guys know, let me go show you on the, Joe, let's go back to this. So when you guys are looking at these papers or these documents that I made, I'm putting the normal link to the paper. Like this one didn't have an abstract. But the challenge is with Sci-Hub papers, where they show you the full paper if they have it, is they sometimes just disappear, or the Sci-Hub website gets shut down. So I not only put the link to the Sci-Hub here to the full paper, but I also put the link to the other paper, the main, whether it's PubMed or whether it's like the LYLL place, so you could find it later if it's not. You can go and look it up again. Okay, hold on. Okay. So let's go back to that. A 21-year-old non-atopic, as in non-allergic man suffering from severe acne vulgaris was put on systemic isotretinoin therapy, that's Accutane, by pill. After 2 months of therapy, he complained of eczema on his wrists, neck, and under his belt buckle. All skin lesions occurred in areas in contact with metal jewelry accessories that he had been wearing for years without them causing any problem before starting isotretinoin. Okay. There are only 3 reported cases in the literature concerning the development of new contact sensitization in patients taking oral isotretinoin. Well, why would they test for a new allergen? Why would they, right? One case was a student who developed dermatitis to rubber gloves she had tolerated before starting isotretinoin. The second case, a young adult, developed allergies to multiple ingredients in ointments used for isotretinoin-induced xerosis. Another case involved a young boy who, after 5 months of isotretinoin therapy for acne, presented new eczematous plaques underneath his watch and belt buckle due to sensitization to nickel. That sounds like a different guy than this. Was it 5 months? No, this was 2 months. This was 5 months. I'm telling you, if you have allergies, folks, you have a vitamin A problem. That's part of it. Okay? I mean, they got rubber glove allergy. They got ointment allergy. We got nickel allergy. And then the research that I have on the research forum showing that the more nickel newborns, even the more vitamin A a mother consumes, or the more vitamin A a child consumes after they're born, the more allergic they are. And they include vegetables and fruit in that exposure. They also include multivitamins, all those vitamins that people are giving their kids. So do I think all these things work together? Yes. So let's do copper toxicity now. So I'm just going to show you guys these real quick. So one of the ways that we get rid of nickel, the main way we get rid of nickel is through the kidneys. And we do it mainly by binding it to albumin, a protein. Okay? Nickel binds to the same spot on albumin as copper does. Okay, so we have, just look at the title here. Binds the same spot there. Let's go look at this one. That was in humans. And it binds to the same spot in dogs. Okay, so copper and nickel like the same spot. Okay, so I talked about the copper's the main way. So if copper is competing for the albumin spots, and you can't get rid of as much nickel, then you could develop more copper toxicity, or vice versa. If you can't get rid of as much nickel through the kidneys because the copper's binding, then you can get more nickel toxic. So now let's get into copper IUDs, right? We already know they cause copper toxicity. This was perimenstrual dermatitis. Let's do this one. So she would get skin problems around her period, and she had a copper-containing IUD. This paper presents the case of a 41-year-old user of a copper-containing IUD who presented with a history of recurrent self-healing skin eruptions associated with abdominal pain. Wow, gut and skin. The eruption followed a cyclical pattern appearing 3 to 7 days before menses and improving spontaneously with the onset of bleeding. Wait, she started detox dumping? She got worse around her period, which is a time of detox, and the hormones surge. and then she dumps the toxic stuff. Okay. Patch testing revealed a positive reaction to copper sulfate and nickel sulfate. After the IUD was removed, abdominal symptoms subsided at the next cycle and progressive resolution of the dermatitis was observed. So they removed the copper. Now, there may be, depending upon which IUD she had, there may be nickel in the IUD. Let me show you that. Okay. But we know vitamin A causes allergies. Does copper increase allergies? I don't know. But it's said that people can actually literally be allergic to copper. I want you to understand this. Like, if we really needed iodine in our bodies, we can't be allergic to iodine or you'd destroy all your thyroid hormone. If we really needed copper in our bodies, you can't be allergic to copper or your body would shut down everything that uses copper, that has copper in it, or that it would shut down everything that needs copper because it just wouldn't work. It's really difficult to be allergic to things that are essential. Okay. Let's get into, this one. Let's go into this. I don't know if I'll be able to zoom in enough on this. Let's see. The Miudella copper IUD. The intrauterine system. Copper surface area. It has a nitinol. Nitinol is nickel. The Ni means nickel. Nitinol frame with copper sleeves. So they're literally putting nickel into women's reproductive parts. What do you think the combination of nickel and copper in a woman's uterus is going to do to her fertility? But that's the goal, right? So if you're hypersensitive to copper or nitinol, then you got to watch out. But it could also make you sensitive to nickel. I'm going to suggest you guys don't do too many super chats. We've already got 2. I got 8 documents to go through, and I'm still on the second one. So we may have to just move them to next week. I'm going to do more on nickel. Don't worry. So yeah, so there's literally nickel in IUDs. Not in all of them, but in some of them. Okay, so let's go. And ladies, and this has been an issue that Kelsey has been bringing to our attention, is if you have a history of low iron status, as in low ferritin, you can get very low ferritin before you get anemic, ladies. You don't necessarily, if low ferritin can happen, but long before anemia shows up. So iron deficiency. So this DMT1, this is divalent mineral transporter 1. It grabs onto things like iron, zinc, and nickel. They're all what are the 2+ or the +2s. Okay, now it doesn't grab onto all the +2s, but it grabs onto a lot of them. So this one of the main transporters that grabs onto iron, so you can have your good iron that you do need, it grabs onto zinc. So iron and zinc compete for this transporter, but it also competes for nickel. So if you are not getting enough, if you are deficient in iron or you're deficient in zinc, your body will upregulate this. And then if nickel comes around, you grab onto more of it. That's not good. So this increases systemic exposure and worsens symptoms. Let me back up. So let's just look here. Women, low ferritin, we consider it below 50 for women. Men, low ferritin is below 30. Ladies, if you have low ferritin, I'm going to suggest to you that one of the most important things you do is to go on a low nickel diet for 3 months. You probably have this low ferritin and low thyroid and weight gain and all this stuff, as we're going to see. This all goes along with nickel toxicity. Okay, so here's one of the problems though. Nickel will increase iron in the literal tissues. So you could be having low ferritin and low storage iron in the liver and having trouble making enough good blood out of it while you're accumulating liver in the tissues. This is classically called iron dysregulation, where you've got too much iron where you don't want it, and not enough where you do. Why do you think we've never heard about this nickel problem before? I think this was one of their little secret weapons that they're going to be very upset. Just watch for, I don't know if you guys saw, I posted on Twitter about this. The day that I started talking about nickel on Twitter, all of a sudden a bunch of bots came out saying, like, if I had a nickel a day for, like, there was all these nickel containing tweets that came out on the day that I posted my nickel toxicity video. It's a weird coincidence. A lot of bots starting to talk about nickel in their posts. Nothing health related, just nickel, a nickel a day, or if I had a nickel for every time. It was pretty interesting. Zinc deficiency. This is the same problem as the DMT1. What does zinc help reduce the absorption of in the gut? Nickel. If you have a zinc deficiency, your body starts trying to grab more zinc out of your gut. It increases DMT1. And then if the zinc isn't there, it grabs onto nickel. And you also need zinc to make metallothionein, which is a metal binding protein that binds to a bunch of toxic metals, especially including nickel. It is quite possible that if you folks have a strong reaction negatively to zinc, you may be nickel toxic and the zinc is kind of kicking it out. And that's the symptom. It may or may not be copper. It could be copper, could be nickel, could be both. Genetics. The way you're wired naturally, you are wired a certain way. You are built a certain way. Just like there's sports cars and there's four-wheel drives. You're likely going to be like one or the other. So women have more problem with nickel toxicity, partially because they detox slower in general, but also because they expose themselves to more. Some people are just going to be more prone to metal problems and this T cell reactivity. This is supposedly one of the things we can fix on a low nickel diet. Your T cells get kind of hyper reactive to nickel, and they're like hyper vigilant for nickel. And then you have immune reactions. So as you kind of starve them of nickel, they become less reactive. And this is part of how the issues go away. And then you can suddenly consume more nickel as you go along. You may not be able to consume as much as you used to, ever, but at least you'll know. And then, as I've said many times, some people simply detox metals or most things more slowly than others. Some people are born to run faster than others. Some people are born to run slower than others. It is the same thing. No one is created equal to anybody else. You are built the way you are built, and it is not the same as anybody else. And it's not it's not a society creation or whatever. Okay. Skin barrier disruption. So if you break your skin open, you've constantly got open skin, whether that's from a skin condition or whether you are doing something like washing your hands all the time, using harsh chemicals on your hands or detergents. If your skin barrier is not good, just think leaky gut. If you got leaky skin and you're putting nickel containing water on it, you're going to absorb more. If you're putting nickel cosmetics on it, ladies, or whatever. Gut dysfunction. If you have gut problems, you probably have, the so-called leaky gut, which we talk about. Well, then that increases the permeability, the ability for nickel and other things to just come through. And then we know that nickel can cause or worsen leaky gut, which retinoic acid does too. Kidney stuff. Kidneys are the main detox route of nickel. So if your kidneys aren't working, so this is the good thing here. Let me give you the good with the bad. If your kidneys aren't working great, you're not going to get rid of nickel as fast. So what's the best thing you can do for them? Stop putting in so much nickel, but also stop putting in so much vitamin A. And then your kidneys can start to repair themselves, and then they can get rid of more nickel as they go. Okay, so remember, toxicity slows detox. So the biggest thing we can do to fix toxicity is to stop putting it in. Now, I was going over this because when I was in my big nickel detox dumping phase. Like I said, I think it started to fade maybe 2 days ago, maybe 3 days ago. It started to lift, and I was like, something's happening here, because I'm suddenly feeling a lot better. And I was feeling like I had been more sensitive to space weather, like a lot more during that nickel detox dumping. Well, why would that be? If you're stirring up nickel, if it's coming out, nickel is literally magnetic, like iron. And nickel increases iron in your tissues. Well, electromagnetic fields. There's obviously magnetism involved. If you are putting more magnetic stuff in you, you're going to become likely more easily affected by EMS. Nickel is also conductive, aka I call it electric. So like electromagnetic conductivity, if something's very conductive, it's more electric. That's why we run copper wires all through our houses and everywhere. So if you have more copper in your system or more nickel that are both conductive, you become more electric. Now, nickel is literally used in NiCad batteries, nickel cadmium batteries. As we'll go over in one paper, the very best mineral to help detox both nickel and cadmium is zinc, which is much less conductive and is not magnetic than copper or nickel. Funny that we would balance it out like that. So, my statement here, these factors of nickel would likely increase your sensitivity while also turning us into conductive, magnetic, some might even say transhuman batteries, while we are increasing our suffering. Isn't that what they want? Is that why they're not talking about it? Because it would become too obvious once it was talked about? Okay, so let's move on. I'm going to try to run through some of this kind of fast, because there's a lot. We're on the third of 8. So nickel absorption basics. So I want to go over this so you guys can understand what is a big deal and what is not. Like I have a whole handout here on nickel in the air. Nickel in the air is not really a big deal unless you live in someplace horribly polluted. Okay? If you get a HEPA filter, it'll basically filter out the nickel. But we'll get to that. Okay, so nickel absorption basics. It's poorly absorbed from diets and mainly comes out in your poop, so it doesn't even go in the system. But if you are fasted, that will increase your nickel absorption from food and water, and this has been shown especially with water. As I said before, the fact it is poorly absorbed and how quickly low nickel diets tend to fix it shows you just how toxic this metal is. I mean, it's toxic in microgram doses. And as I said before, remember 100% of your gut cells are exposed to dietary nickel or water nickel, and that 100% of your skin cells are exposed to nickel in your bathing water sources. So even though they might say you don't absorb a lot of it, that'd be like saying somebody pours acid on your skin and they say, well, you don't absorb much of the acid. And you go, but it like burned my skin off. Okay, well, think of the nickel could be absorbed by those cells. It affects the cells and it could be absorbed by those cells. It doesn't mean it has to go systemic. It could be stored right there. Oh, a lot of this stuff is from there's a World Health Organization report that I'm going by. Like I said, I'm not a big fan of the World Health Organization, but they've actually literally put this out and nobody's talking about it. Absorbed nickel, as they say, is rapidly cleared from serum and excreted in urine. This is my addition here. Some is stored in the tissues along the way. So if absorbed nickel was always rapidly cleared from serum and excreted in the urine easily, there wouldn't be a nickel toxicity issue. So these are like the statements that they make to try to downplay it. As we went over before, iron deficiency increases intestinal nickel absorption in vitro, so that's in the petri dishes, and in vivo in animals and humans, indicating that nickel is partially absorbed by the active transfer system for iron absorption in the intestinal mucosal cells. So the intestinal mucosal cells literally have the DMT1 transporter to absorb iron and nickel. Do you think some of it might get stuck there along the way? We already talked about this stuff. Pay attention here. Absorption of soluble nickel compounds from drinking water is higher than that from food. Drinking water on an empty stomach drastically increases absorption. Absorption of nickel from drinking water on an empty stomach is 10 to 40 times higher than the absorption from food. If you have nickel in your water, I hope you're filtering it out. So here's some statistics. So they added nickel sulfate to drinking water. About 27% was absorbed. The same nickel sulfate added to scrambled eggs was only 1% absorbed. So that's a 27 times difference. You absorb less nickel from food, or if you drank the nickel water with food, you absorb less too. But you're still absorbing it. It's still causing problems. That's basically what I'm saying here is if you have food, they gave them scrambled eggs. They loved the scrambled eggs in the nickel studies, I guess. If you have scrambled eggs if you had the water, nickel water, 30 minutes or 1 hour before a meal of scrambled eggs, it was less in the blood. There was less in the blood. Let me say this right. They gave them nickel in drinking water. It was given to fasted males. The nickel in the water was more rapidly absorbed if the dose was given 30 minutes or 1 hour before a meal of scrambled eggs than if given at the same time. So what they're saying here is if they gave the water a half hour or probably 1 hour before the meal, the peak concentration of nickel in the blood was 13 times higher. Pay attention here. Plasma levels in fasting human subjects did not increase above fasting levels when 5 milligrams, that's 5,000 micrograms of nickel was added to an American breakfast or a Guatemalan meal rich in phytic acids. The same amount of nickel added to water by itself elevated the plasma nickel levels 4 to 7 times. So are you seeing here a pattern of like nickel in your water goes into your system way, way, way more? Now, let me also say this about, so they gave them an American breakfast or a Guatemalan meal rich in phytic acids. So it's rich in phytic acids. Do you remember in that last nickel toxicity episode, I went over cancer and how in every single spot they injected nickel into animals, they developed cancer at that spot? Funny that nickel and iron are absorbed by the same transporter, and people are taking IP6, inositol hexaphosphate 6, literally phytic acid capsules to fight cancer. So they say that the phytic acid is grabbing onto iron. But is it? These phytic acids, are they grabbing onto the 5 milligrams, 5,000 micrograms of nickel that they gave them? And they're not seeing the blood level of nickel go up at all. So maybe the phytic acid, the IP6 that is helping cancer people, cancer patients, is really grabbing onto nickel. Can we know that, as we said, every single place that nickel was injected in animals, cancer started there? Fun connections, huh? The absorption of nickel added to milk, tea, coffee, or orange juice was significantly less than the absorption of nickel from water. So basically, anything coming in with nickel is going to reduce your absorption over just plain water. Do I know why? No. Okay, nickel detox basics. This is where we want to pay attention because people are asking. I see Laura Lee asks about, I'm curious what your nickel was on the hair analysis. I know you mentioned you'd like to do serum blood levels to check that. I'll talk about testing in a second. There was no difference in nickel absorption and excretion between 20 nickel sensitized women and 20 age-matched controls. No different in absorption, no difference in excretion. So they're talking about, I'm guessing the nickel absorption, they're measuring blood, and the nickel excretion, they're measuring urine. And they're saying you have 20 women who have problems with nickel, And you have 20 women who don't seem to have problems with nickel, and everything is the same. And there's studies that say that they put people on a low nickel diet, and some of them didn't react to nickel in the oral mucosa patch test, where they put nickel like literally on the inside of your lip. Some people didn't react to it. Most of them did, and all of them improved. So if you are looking for a test, a magical test to tell you whether you're nickel toxic or whether you need to do this or how nickel toxic you are, you may or may not get it like you want it. Okay? As we said, the main detox route is kidneys and urine. We are looking into LabCorp. LabCorp has a urinary nickel test, and we're seeing if we can make that available. And they have a blood nickel test too. And then the hair test. Okay, the hair test, this is what this is my theory right now. And I've talked about this theory before, so it'll be interesting if this pans out in the real world. I'm letting my hair grow out right now on the sides and the back so I can do a hair test in probably about 2 weeks. I have a suspicion that when people are consuming nickel regularly, you may not be detoxing it very well. Think about this. I'm saying very quickly, when people go on a low nickel diet, within 2 to 3 days, they start dumping nickel like crazy and they're getting crazy symptoms. Okay, that should probably be showing up in a hair test or a blood test or urine. That should be showing up. So what if the opposite is true? What if people are consuming nickel? Consuming nickel slows down the detox. I've been over this before. It's like with the mercury fillings. People get mercury fillings put in their mouth, and it actually slows their mercury detox. And then when they get the mercury fillings out, they start dumping tons of mercury. Gosh, what a crazy story that we've seen before. So and they start dumping it like crazy. So, and we've seen mercury go up on hair tests, the fish and shellfish type mercury. Oh, okay. Well, I don't know how much was missed, but okay. Oh, okay. Well, so where was I? Oh, so when people get their mercury fillings out, so I want you to understand something about the hair test. The hair test, there's two main types of of mercury. Think of it as the mercury that's the metallic mercury that's in fillings, and then there's the organic mercury that's in fish and shellfish. The hair test normally only shows the type of mercury that is in fish and shellfish, what they call organic mercury, not metallic mercury. But we have seen it when people get the metallic mercury taken out of their mouth, that suddenly on their next hair test, they're not eating fish or shellfish, but the organic mercury on their hair test spikes up. Their body started dumping mercury from its stores because you stopped intoxing and you could start detoxing. So what I'm wondering is, might this happen with nickel? I get on my low nickel diet, and I've been very good on a low nickel diet. I find the low nickel diet extremely easy to do. Probably because I tended to feel bloated if I ate too many beans or oats. And so I did less and less of them over the years. Maybe that was nickel. I don't doubt that I have a nickel problem. I mean, with all the detox symptoms I've had during it, yeah, I think I had a nickel problem, as well as the other things that we've worked on. So anyway, what I'm hoping to see is that with the symptoms that I've had, obvious detox, and then taking nickel out of my diet enough that I'm getting these detox symptoms, that in 2 weeks-ish, I'm going to do a hair test. It'll take me another month to get it, but I'm hoping that I'm going to see a spike in the nickel, showing that it's coming out. And it does come out through the sweat and the skin and the hair. Not a lot, but it does. So that's the plan. I don't know if I don't know if I'm going to do the blood test. I'm going to see if I can get the urine test. I'm just seeing what we can do with LabCorp. And then am I going to be recommending this to everybody? Probably not. I'm just going to say you should do 3 months of this. If you want to do the test, go ahead. Okay. Very little nickel comes out in the bile, only 0.5%. And then you just poop out what you don't absorb, which makes sense, right? If you eat fiber and you don't absorb it, you poop it out. Okay, that makes sense. Sweat and hair and skin eliminate some, and the nickel coming out of your skin can cause skin issues. Gosh, who's ever talked about the toxic stuff in your sweat coming out of your skin causing issues on the way out? Ladies, nickel crosses the placental barrier. Ladies need to pay attention here, and guys who love their ladies and you want to have babies with them, nickel crosses the placental barrier. Nickel is eliminated in the milk of lactating women. It is present in the milk of lactating women. So for all those guys who are like, why would vitamin A be in breast milk if it's not supposed to be there? Why is nickel in breast milk if it's not supposed to be there? Because women detox through their breast milk. That's what they do. The human body is not always equipped with being able to make choices about things. It can't be like, oh, you just ate some food. Well, this is toxic. We're going to not absorb that, and we're going to keep all the good stuff. Your body doesn't work that way. Your body it just like absorbs stuff, or it just excretes stuff. Nickel has been detected in fetal tissues at levels similar to the levels found in adults. Are we wondering why so many of us and our kids are being born sick? Wait until we'll get into probably in the future nickel and ADHD, nickel and autism, and all these fun things that are going on today. So let's get into the next one. Nickel in the air. This will be short. This is easy. It's not a big deal. But I want you to pay attention here. Nickel concentrations in remote area air, 1 to 3 nanograms per meter. Rural and urban air, 5 to 35 nanograms per cubic meter. That's a big difference, right? It is. So the further away you get from the cities, the less nickel in the air. And this is non-occupational exposure. This is people who don't work with nickel. Urban areas are 0.2 to 1. Rural areas are 0.1 to 0.4. So basically, if you're in the city, you're breathing in more nickel. Mainstream smoke of one cigarette contains about 0.04 to 0.58 micrograms of nickel. Doesn't seem like a lot. However, remember that your lungs are specifically designed to absorb stuff. HEPA level filters remove most nickel, the types of nickel that would be present in typical air pollution. So how do you fix nickel in your air issues? What do I do, doc? Don't smoke anything. Tobacco, marijuana, vapes of all types all have nickel in them. Vapes have nickel in the element, the heating element, and possibly in the vape juice. I mean, if you're vaping, you probably shouldn't be listening to this show if you're vaping, because you got so much catching up to do. You're probably still microwaving your food if you're vaping. And yeah, you shouldn't do either of those, and maybe go get some basics of health stuff and then come back here. I don't know. Don't exercise in places with lots of obvious air pollution. I've talked about this before. Don't exercise. Okay, so first of all, you guys who are firefighters or cops or EMTs or paramedics, and you're standing around like all these running engines all day, just sucking down the pollution, the exhaust. Like there's literal studies showing that lowers your testosterone. I don't understand why everybody leaves all those stupid engines running anyway. What about climate change? Yeah. Anyway, it's just, we got to leave all these engines running because it'll take us a whole 2 seconds to start the engine again. I don't get it. I can't see any good reason for it, and nobody's going to explain a good reason to me about it, to just be sucking down exhaust the whole time. So car exhaust. Don't take your jog on a busy street. Don't work out at the outside part of your gym on a busy street. Like if you're walking outside and you smell a bunch of car exhaust, just remember your olfactory nerves, your sense of smell adapts to the same smell If it's the same strength of smell, you tend to adapt to it within like 15 seconds. So you go outside, ooh, it smells like car exhaust. And then 15 seconds later, you don't smell it anymore. It doesn't mean it went away. It means your nose adapted to it. So like, don't go for a jog down the street in rush hour. Like, you're breathing in like 20 times more oxygen. Don't go out and do it in air pollution. Okay. Moving further away from urban or city air is always generally a good thing for health. And these are the air filter standards that remove nickel from typical air pollution. So a true HEPA filter, true HEPA. It's not like, I was learning that there's like HEPA-like and like sort of HEPA, where they use all these filler words where it's not HEPA, but they kind of imply that it is. And I don't know what these mean, H13 or H14 certified. Some of you air filter people out there will know that. That's just an upgrade, I guess. Okay. Moving on. Nickel in the water. I've been looking into this a lot because Kelsey had a water test and her nickel was above the European Union standard of 0.20, which I think is 200 micrograms per liter. Hers was at like 290. And I was reading that on a low nickel diet, you want your water to be below 70. So she was supposed to, I don't know, I don't have that reference, but she found somewhere that it was supposed to be below 70 and her water is 290 and the European Union said below 200 was okay. But we'll get to that. We already went over this one before. Drinking water on an empty stomach is 10 to 40 times higher absorption of nickel than from food. Where can high nickel in the water happen? Groundwater, like well water, and tap water. The two big places where everybody gets their water. Could be from pollution, could be from areas where natural nickel in the ground was mobilized. Kelsey's water is well water. So we are looking into how to address that now, which I'm going to talk about. Okay. So significantly higher blood nickel levels, serum nickel levels were observed in non-occupationally exposed subjects. So that means they don't work with nickel from a heavily nickel water polluted area compared to subjects living in a control area. So what did that just do? I didn't want that. In the polluted area, these are the people who are drinking water that's high in nickel. So there's 109 micrograms per liter. Their serum nickel levels were 0.6. 109 and 0.6. The control area was 0.6. 109 versus 0.6. The serum nickel levels were then 0.2, so they were a third less. This is like, I don't know, what is that? 10, 15, 17. Is that 170 times higher? Something like that. Yeah. Pay attention here. The primary source of nickel in drinking water is leaching from metals in contact with the water. This is really important. Water left standing overnight in the pipes, in the plumbing fittings, plated with chromium on a base of nickel, contained a nickel concentration of 490 micrograms per liter. Okay. So look up here at the polluted area, 109, water left overnight. So it's just the water that was in those pipes that was sitting there stagnant. So it's not all the water. It's just the water that sat in the pipes. But they're just saying these are just from the plumbing fittings. So what you want to do, I'll go over this again later. Never. So if you're like getting the shower in the morning, this is easy. You turn on the shower, it runs. And it runs out all that stagnant water that's full of mineral, like copper and nickel and all that stuff from your pipes, lead, whatever. Don't go and fill up, unless you filter your water like well, don't go and drink the first water out of the tap. If you've ever noticed it tasted like metal, it's literally metal in there. Okay? So they're saying if you got new pipes, leaching of nickel from chromium nickel stainless steel pipework into drinking water diminished after a few weeks. So it wears off a bit. There's the initial surge with like new pipes, and then it wears off. Okay, so they're just saying again, new stainless steel pipes. It was up to concentrations of nickel leaching from new stainless steel pipes used for drinking water up to 6 micrograms per liter. This can be increased when the pipes are assembled with tinned copper and gunmetal fittings. I'm not real familiar with the plumbing stuff like that. Fittings such as taps, which are chromium plated, release much higher concentrations, but these decrease significantly with time. So there is kind of a wearing down of the initial surge. Doesn't mean it goes away completely. For you well folks, certain stainless steel well materials were identified as the source of increased nickel concentrations in groundwater wells in Arizona, USA. Yay for my place. Mean nickel levels were 8 to 395 micrograms per liter. In some cases, nickel levels were in the range of 1.1 to 5 milligrams per liter. That's 1,000 to 5,000 micrograms per liter. Remember, this is 395 coming out of the well. That's not just the first flush of it. Remember, this was the nickel polluted area, was 109. Oh, let me get rid of this. The nickel polluted area was 109. Leaving the water overnight, the water that you would want to flush was 490, and this well water was 395. And in some cases, it was 1,000 to 5,000. How much more do you absorb from the water on an empty stomach? 10 to 40 times more than food. For those of you with electric kettles, concentrations of nickel in water boiled in electric kettles may, depending upon the material of the heating elements. So you need to ask who made your kettle what the heating elements are made of. It may be markedly increased, especially in the case of new or newly decalcified kettles. So if you put a bunch of vinegar in your kettle to clean it, because you got hard water and you got calcium deposits, you're going to strip all that off of the nickel element potentially. So then you got fresh new nickel exposed to the water, and then you're going to heat it. Heating metal like stainless steel pots and pans leaches more nickel. So if you got a water kettle, an electric water kettle with a nickel element, that's going to be pretty bad. The greatest concentrations are associated with nickel-plated elements. However, leaching decreases over time. Nickel concentrations in the range of 100 to 400 micrograms per liter, with extreme values over 1,000 micrograms per liter, have been reported. These are similar to the well. Nickel concentrations in groundwater, that's wells too, depends on the soil use, pH, and depth of sampling. Acid rain might increase nickel concentrations in groundwater. So if you live in a place with acid rain, so again, this gets a little different. Average nickel concentration in groundwater in the Netherlands ranges from 7.9 in the urban areas to 16.6 in the rural areas. So that's not what we expect. We would normally expect the toxicity to be higher in the urban and less in the rural, but this is flip-flopped. Nickel concentrations in bottled mineral water will depend on the source and any treatment applied, of course. Levels of nickel in a selection of bottled mineral waters were below the detection limit of 25 micrograms per liter. So of the bottled mineral waters that were tested, they were generally low nickel. Okay, now we're going to get into this. People are going to say, how do I know if there's nickel in my water? What do I do? How do I search? I don't have time to become an expert on your own area. Here is what you're going to do. First, you need to find out if your home's water has a nickel issue first. You're likely either going to be on tap water from the city, municipal water, or you're going to be on a well. Okay, I'm just going to say it right now. If you have well water, you can't just assume. You need to get it tested, no exceptions. The filtration guy we're talking to up in Idaho for Kelsey's house, they're coming out and they're going to do a free water test for us on both the well, the kind of the shared well, and Kelsey has a well hole drilled on her property that she's not using yet, and so she has her own private well, and we're going to get that water tested too, and we're going to compare them and see which one we want to use. Okay, pay attention here. That, gosh, there's no conspiracy to poison the West, especially the US. Is there? I don't know. You tell me after you see this. The maximum accepted nickel concentrations in water, European Union, 0.02 milligrams per liter, or 20 micrograms per liter. The World Health Organization. So this is, EU has a legal limit. Legal limit. The World Health Organization has a health guideline of 3.5 times as much, 0.07. The USA has no federal maximum contaminant level currently set for nickel. So there can be as much nickel in the water as they put in it, as they leach into it. I don't know. Now, these are search places. This is how you can go and search. Okay, so again, it only, like, okay, so let's say you had a bunch of plumbing fittings and faucets and all sorts of stuff in your house. And you go and you do one of these, you search these places for nickel in your water. And they all say your water's fine. But then when the water gets to your house, you have all sorts of toxic plumbing. We'll just say it that way. You're not going to know what the nickel situation is in your water unless you test the water coming out of your tap. Test, don't guess, then address. What am I doing with Kelsey's house to get her situation? She has a water test. She literally has a water test from before. It was 0.029. So if we're looking up here at the EU thing, hers was 0.029. Okay. And I'm like, that's not an alert level. It's like, they called it like an advisory level. Like you should kind of work on this. So what are we doing? So she had it tested. We found there was an issue. Okay. She's drinking RO water. So that's the drinking water is not an issue. But so then we called the water filter people there to get started on fixing this issue, because we tested, we didn't guess, and now we're addressing. And they're going to come out and they're going to test the water again for free. And then we're going to figure out how we want to address it. Okay, we're not guessing. I mean, we're going to test the well water too, but we already know there's nickel in the well water. So do we really need to test it that much in the house? Or are we just going to address the whole water system? Okay. I just talked about this. If you don't filter your water at all, you need to get rid of the stagnant water that's been sitting there overnight every morning from at least your kitchen tap. Okay. And you probably are automatically do it on your shower. Okay. The practical rule of thumb on how to flush stagnant water. You run cold water, not hot, until it becomes noticeably colder and stable. Like, so the temperature becomes stable. Always realize that hotter water will leach more nickel and copper from pipes in general. And don't believe any water guy who tells you that copper pipes don't leach copper into the water. We have tons of people who have switched from using their normal shower water. Let's say they didn't have a shower filter, or they just wanted to try this. They try doing a sponge bath with clean water, and they feel better than if they took a shower. So you ladies who are taking like super hot showers, you're not doing yourself any toxic mineral favors. And another rule, never use hot tap water for drinking or cooking. Get cold water and heat it up. So to flush your system, 30 to 60 seconds for a small home or apartment is the minimum effective. So if you were just going to do a minimum effective anywhere in your house, this is the minimum. Okay. 1 to 2 minutes for the average home. So if you were going to do anywhere in your house and you wanted the safest general practice, That'd be 1 to 2 minutes. 2 to 3 minutes plus is for a large home, or if you know you have older plumbing. Obviously, like I said before, the kitchen tap is the most important one because that's where everybody's getting their drinking water for the main part. And after a long stagnation period, like a multi-day vacation, flush for 5 to 10 minutes and consider flushing each tap separately. Now we get into water filter options, water filtration options. Now, distillation. I want you guys to pay attention to this because this is a little nuanced. Okay. I'm not against any of the stuff that I was doing before. I'm letting you know the reality of it. Okay. Distilled water makes clean drinking water. I swear distilled water is like my favorite water ever. I think it tastes the best. Getting a whole house water distiller is not really practical, and it's pretty expensive, and you heat off a lot of water. I mean, it's just expensive. You're just boiling water all day. If you say, are they made with stainless steel or nickel? I believe there's stainless steel in them. Yeah. You're going to have to figure out what they're made of. I do not have time to go and research every water distiller. Kelsey was looking into the heating element on hers. Reverse osmosis. Now, this is important also. I talked to a water filter guy. He said whole house systems waste, like the systems that they were talking about, it wastes 8 gallons of water for every 1 gallon you get. I know, water is recyclable, right? I mean, reusable, sustainable, whatever. I mean, water is just going to go back into the water system. But I don't want to waste 8 gallons of water to get 1 gallon of clean water. And he said they were really expensive and they were pretty impractical. Okay, so what can you do instead if you want really clean drinking water that's easy to get? Reverse osmosis at the point of use, as in your sink. So then it's at your sink, so it's gone through all the pipes. You're filtering it there, so there's nothing else for it to go through. Okay? This is important for some of you. Most RO systems can make the water a bit more acidic due to removing the minerals. Minerals are alkaline. So if you remove all the alkaline minerals, it can become a bit more acidic. This is just chemistry. However, reverse osmosis removes all those other toxic things, which is why we like it. Remember, we would rather have things be a little too clean and a little more empty than to be, I don't want lead in my water just so I can say, oh, I've got the natural calcium still there. I don't want that. I want the lead and the calcium gone so I'm not taking in the lead. Remember, we want to stop intoxing before we start detoxing. And those of you who have started a low nickel diet on your own and you saw how fast you started detoxing when you stopped intoxing, you know what I'm saying. Okay. Here's an important point about the RO systems, like the countertop or the in-sink ones, not in sync like the band, but the ones that are not AquaTrue. Let me put it that way. If they make your water more acidic, the two things that cause more nickel leaching off of stainless steel stuff, heat and acidity. What are you going to do if you're cooking? You're heating. What if you're cooking with lots of water for beans, whole grains, whatever? You now have hot, slightly more acidic water. So if you're cooking in pots and pans and utensils and instant pots that are stainless steel, that may be, am I telling you to throw all of this away? No, I'm just saying, I've always recommended the AquaTrue system because the AquaTrue reverse osmosis system doesn't make the water more acidic. I don't know how it does that. But this is another reason that I did a good job of picking something and I avoided a problem in the future by recommending the RO system that did not make the water acidic. I didn't know this back then, but I knew that I'd rather keep the pH of the water the same. Now, this is a new company that I've learned about. Sante for Health. Do I have any of their products? No. I'll say it right here. I have no affiliation with them, and I just personally ordered a shower filter setup from them. I got the sediment filter plus the dual shower filter. It's actually going to Kelsey's house. And I'm considering their whole house setup because, let me show you. So here's their main website. Anyway, this is their main website, but I wanted to go to this one. Now, this is their claims. This is not some like, this seems like a very legit company. They've got the certifications, the NSF certifications. Okay, let me go down here. Oh, wait, sorry, I'm not sharing. There we go. Sorry, Joe. Here it is. These are their claims. We are well beyond the Aqua Youth 2.0 right here. I mean, the price is beyond too, because, this is a $200 shower filter. So this is not like a $30 Amazon Aqua Youth 2.0 job, which I thought was the best I could find before, but I started searching for nickel and this came up. So nickel was down here. Removes up to 99.9% of nickel, reducing potential skin irritation and allergic reactions from this common metal. Copper is on here too. Where was copper? 99.9% of copper, preventing metallic taste and potential staining of fixtures. So, what is this herb? Oh, herbicides. Removes 85% of herbicides that may contaminate water through agricultural runoff. So this is their claims. You can go and check this out. I was most interested in the copper and the nickel, and this is on their shower filter page. And they have shower filters that are made more for well water. So they work more on like iron and heavy metals. And they have shower filters that are geared more towards city water, which I think that those take away more of like the organic type chemicals. Yeah. So anyway, I'll show you this here now. This is just, like I said, I have no affiliation with this company. They just have all sorts of filters, and they offer, as I said in the presentation here, they do free consultations on your water report. So you need a water report to help with their product recommendations. So what I am thinking of right now, we're going to try out the shower water filter that arrives like, I think, in 2 days. And then if that works, and they're up in Scottsdale, I may go visit them. They're about a 2-hour drive north of me. I may get the whole house filter because it doesn't waste any of the water, and if it's reducing 99.9% of the nickel and a bunch of other stuff, and it's designed for well water, sounds good to me. So, and it's got a sediment filter built into the whole house system. So yeah, so there's that. But do not consider me some water filtration expert. Okay, so now we get into the big deal. So the water is a big deal so the nickel in air is not a problem. Nickel in water can be a significant problem if it's there. It may not be there. Nickel in foods is where we want to think about. Now I'm going to have a bunch of caveats and warnings and other stuff at the start here, because this low nickel diet is, well, I'll just read what I wrote. Warning. If you go from a love your liver type diet where you are consistently eating whole grains, especially oats and barley and or beans and or nuts and seeds, and you immediately jump into the full low nickel diet, notice the all caps, you will feel significant nickel detox symptoms start within days. So if you have a big thing coming up at work, or if you got stuff that you can't, the nickel detox symptoms can be rough if you dive in. They can be rough. The last week or two before I started feeling better, I was kind of wondering what the heck is going on. And I'm sure those of you who started the low nickel diet based on the information I gave last week, you were probably wondering what was going on and trying to blame the diet, because that makes sense, right? Well, I didn't know that the dumping was going to come as hard and fast as it did. And as I've said before, like if you push detox too hard, you don't know when it's going to end. You don't know how much of that stuff you have in you. So you don't know when you're going to get out of it. So if you do that, you're pushing as long as you choose to push. With the initial nickel dump, that seems to come and go. It seems to be very fast. The biggest thing about nickel, why is the low nickel diet in all these studies like 3 months long? Because it seems like nickel is more of an irritant when it comes in. It doesn't get stored a ton. It's just that we're constantly putting it in. So if you stop constantly putting it in and you address the things that are adding nickel to your daily life, like, okay, so let's say you address the air, you address your water situation, you address your cookware situation, you address just the basic things that you have to do every day, and you reduce the nickel there, and you do a low nickel diet and you reduce your body's reactivity to it, then you may be able to go back to doing, the oats that you like and the beans that you like and that stuff. I don't know yet. All I know is that there is a systematic approach to trying to poison us. That's what I know. So, I guess we've got some troublemakers, huh, Joe? Interesting. Maybe they're bots. So an important thing here, you don't have to do this at all. We've been getting people better with the Love Your Liver basic approaches for years now. Years. You don't have to do this. If you never do this, and you've had stubborn health issues that haven't gone away with the Love Your Liver program, this might be it, and you'll never know. And this is another important thing. If you half-ass the low nickel diet and you get simply more nickel than your body needs to kind of jump into that detox mode, you may not get the results you want, and then you think that it didn't work for you. That this has been said in the nickel allergy world. Like, if you don't do the diet well enough, you may not get any better. You may have reduced your nickel, but you may not get any better. Okay. Fixing your base level of nickel toxicity will improve your nickel tolerance. You get less intolerant of nickel as you get less nickel toxic. And you will then forever know your nickel related symptoms. The nickel allergy world calls it getting nickeled. Like, they literally know they react to when they get too much nickel. The strict low nickel diet is not meant to be forever. So it can be. Like, I talked to Matthew Good Texture from Twitter, and we're both kind of like, I like this diet. Like, this works fine. I don't need much else. And let's say you start the low nickel diet and you don't feel good because you're dumping, or you jumped in too deep, too fast. You can always go back to what you were doing before at any time. You can shut it down. If you were eating oats, we already had a guy, he was eating oats. He switched to bananas instead of oats, and his skin on the low nickel diet, his skin just started getting super, super dry and cracked. And I think it might have even been bleeding. He gets back on the oats. That all goes away. I think he tried it again. If I'm remembering correctly, he tried it again with some rice instead of oats, and he got the same issue. So he went back on the oats. And this person knows, we talked about it, and they have skin and gut and neurological symptoms. What are nickel symptoms? Skin and gut and neurological. So we were both talking about this, and we both agreed that he probably has a lot of nickel toxicity. And he's dumping a lot of it. So we're going to walk into it this next time instead of dive into it, okay? I'm going to repeat this part. We have already seen multiple people simply remove oats from their diet. Like, my buddy removed oats. Replaced with low nickel starches and fruits and start getting strong nickel detox symptoms, as in coughing, skin symptoms, gut symptoms, neurological symptoms. These symptoms do pass. However, it seems to take about 2 to 4 weeks. So if you're not willing to get through the 2 to 4 weeks, then go slower or you walk into it. It is much easier and nicer to do it slowly and get the right supplemental help, as we're going to talk about. And I'm going to cover the supplement strategies in just a bit. Here's an idea of how you could walk into this rather than run. Week 1, reduce your whole grains and beans, assuming you're doing Love Your Liver, by half. Okay? It doesn't mean you're reducing your calories. You are replacing the calories with low nickel starches or fruit, and then you're going to start figuring out your low nickel fiber substitutions. This is an issue. And no, there's not a lot of good fiber substitutions. What am I doing right now? I'm doing apple pectin and glucomannan, and I have some I'm using Sunfiber, and I'm trying Nutrim again, which is oat beta-glucan, which should be just fine in terms of low nickel. The barley beta-glucan company, Sarah Beta, I contacted, said that their barley beta-glucan has, in one serving, one scoop, 3.52 micrograms of nickel, which is considered very low nickel. So I'm going to assume that if the barley beta-glucan is that low, I'm still waiting on Nutrim to get back to me, but I'm going to assume the Nutrim is low. And I haven't felt bad doing it. So, okay, so if people say I don't want to use supplemental fiber, like if you're literally eating beef and poultry and like rice and bananas, you're probably going to get a little constipated. This is a short-term diet. I've felt better since I started the apple pectin and the glucomannan. And I'm wondering if the soluble fiber without the nickel is going to be just fine and not cause people problems. If you're anti-supplements, if you were anti-meat, like you want to be a vegan or a vegetarian, and you're anti-supplements and you try to do a low nickel diet, you may just be screwing the pooch. I don't know. So week 2, if you were doing this, or you could do week 1 as long as you wanted. You could extend this as long as you wanted. And then week 2, you would continue reducing your whole grains and or bean consumption by another 50%. So then you'd be at a quarter of what you were eating before you started reducing, while you're continuing to replace the calories and figuring out your low nickel fiber substitutions. Week 3, maybe you eliminate the rest of it. And really, then you would be considering to start the 3-month low nickel phase in full. As I said before, you can always go slower. You can always go back to eating what you were before. You are not locked into anything. You don't have to do this. So if anyone approaches me as saying, Dr. Smith said I had to do this, I didn't say you had to do anything. I never say you have to do anything. People who say I told them they had to do something are simply trying to dodge responsibility and accountability. I'm just putting information out there. Basics of nickel in foods. Okay, when we get into the food stuff, there are all sorts of low nickel approaches. You're going to go out on the internet and you're going to get confused because you're going to say, this place said onion is okay, and this place says onion is a no, and this place says coffee is okay, and this place says coffee is a no. The biggest, I'll get to that. In general, the generalities of food groups, whole grains are considered a high nickel food. Kind of higher nickel than that, beans, seeds, nuts, and wheat bran. And the highest nickel foods, the one that people eat the most generally is chocolate, cacao, cocoa. Okay. Now I heard somebody say that in Nickel Navigator, which is an app you can get that talks about the nickel in foods, and it shows you just how wide ranging the amount of nickel in foods is. Apparently inulin root is the absolute highest nickel containing thing in the entire program, in the entire app. I have advised against inulin for years. inulin, when I would try to eat Jerusalem artichokes, or what's the other inulin food? I forget. Chicory root. Whenever I'd try to eat these high inulin foods, because I heard they were good prebiotics, it was the worst bloat I could have imagined. And I just told you that one of the reasons I've been shifting towards less oats and beans over the years is because they make me bloated. So is it the fiber or is it the nickel? They want to make everything unhealthy for you. That's their goal. So stainless steel cooking utensils, pots and pans contribute to nickel in foods. This is up for debate. However, when you think of how big the stainless steel industry is, they would love for you to believe that you can buy their stuff and it's not a problem. So you got to remember there's this gigantic industry behind stainless steel who can pay scientists to do studies that show what they want. But what would increase nickel leaching from, so like as an example, okay, so cooking stuff. The two things that increase nickel leaching from stainless steel: heat, cooking, acidity. I don't think we're cooking a lot of acidic things except for that little reverse osmosis water thing that I mentioned. Okay. But that's not really like super acidic. So those things might be an issue. Now, people go, do I need to get rid of my stainless steel water bottle, Dr. Smith? Well, if you read the research on that, what was the Stanley stuff where they were finding like lead and cadmium in that stuff because it's like cheap Chinese crap? Well, if they're getting lead and cadmium out of it, there's probably nickel coming out of it. However, if you have good stainless steel and you just have a water bottle and you're just putting water in it, am I going to say that you have to like toss out all your stainless steel water bottles? I'm not saying that. If you want to be as careful as possible and you wanted to eliminate that nickel source in your day-to-day diet, that's up to you. I'm probably not going to buy stainless steel water bottles for daily use anymore. But I've been going to glass for a long time. Like that's why I got. Okay, so again, the AquaPure in terms of RO water for cooking I still recommend it because it doesn't make the water more acidic. And the link here, the Home Chef brand is nickel-free cookware. Some people have said that there's nickel-free some of the utensils and stuff, the cooking utensils at IKEA, but you got to check each one. I want you to pay attention to this part. This is really important. This is from the WHO article. The average nickel intake of different diets. Stop. A normal diet averaged 0.13 milligrams a day of nickel. So 130 micrograms. A low nickel diet was basically 70 micrograms, or half of that. So a normal diet to a low nickel diet. A high nickel diet where people were purposely eating high nickel foods was about 0.25 or 250 micrograms. And UK vegetarians averaged 0.17. So vegetarians and vegans are by nature going to be eating more nickel than omnivores or carnivores. So, I mean, wow, this low nickel diet, look at this range. Somebody got down to 20 micrograms a day. So if we look at this, at the highest range of the high nickel diet was 0.48. So 480 micrograms of nickel a day. The lowest of the low nickel diet was 20. So we have 480 versus 20 micrograms. And it is said that we don't absorb very much nickel from food. How toxic is this metal? Very toxic. We're literally having people reduce, if we just go by the averages. Let's say our people are doing a high nickel diet, okay? They're going from 25 to 50 to 70. They're reducing their nickel intake by 180 micrograms a day, and they're starting to dump like crazy. Okay. Obviously, if people are getting nickel toxic out there commonly, you're going to have to get below 130, 150, 130-ish micrograms a day because that's the normal diet, which is keeping people sick. Okay. I'm just going to cover some basic things here. There, as I said before, there's multiple ways of doing a low nickel diet if that was one's only goal. If you were just doing low nickel, there's multiple ways to do it. All you really have to do is get your nickel down low enough for you to be getting rid of more than you're taking in. What I'm going to go over here soon is a low nickel. I came up with this, a low nickel, low copper, moderate manganese, and low vitamin A diet for the first 3 months. And we'll go over that in a bit. Okay. There's several standards as to what low nickel means. So the low nickel diet above said it was 70 micrograms a day on average. One person got down to 20. Some studies, as I'm going to go over here, simply have people avoid a high nickel foods list or the forbidden foods list. And that's all they have them avoid. They're like, you can eat anything that's not on this list. Some have people to get their daily nickel under 2.8 micrograms per kilogram of body weight. So let's see if let's see, where's my calculator? Hold on. Where's my calculator? There it is. So let's just do 2.8. Come on. Joe, your Telegram popping up on my screen gets in the way. 2.8 times, what was it? 90 kilos. So I would be allowed on that standard 252 micrograms of nickel a day. I don't want that much. I'm going to get lower than that. And some just have people get under 150 micrograms of nickel a day, which is still averaging the normal diet. So remember, I said if you half-ass the low nickel diet, you're not going to get the results. That's what multiple people have said. They said if you're going to do this, you need to commit. You don't have to do it. So these are from some papers that I found. These were what they mentioned about the low nickel diet. Okay. This is just a quote from it. Examples of nickel-rich foods include tree nuts, various cereals, soy, chocolate, salads, broccoli. Broccoli comes up over and over. And animal liver and kidneys. Gosh, those organ meats full of toxic things. So if you guys want these links, that's the Sci-Hub is the full paper. Okay, so this is a paper that had two different approaches in it. They had a forbidden foods list, which is what they started people using. Okay? They started people on the forbidden foods list. I'm not going to read these out. Okay? They also, in this paper, I took the screenshot because it was too much to type out. They created this, what they called the balanced Brahmani diet, or Ni, whatever you want to say. It's two of the authors. They're the start of their last names, and then nickel. So they made this low nickel balanced diet for an adult man or woman of normal weight, and you can read through it. Okay. They're not even giving men 2,000 calories though. Okay. That's not, I'd be hungry on that. Now, again, okay, there's going to be plenty of calories available. If you try to do a low nickel diet and you say, I'm not getting enough food, you're not getting enough food. If you aren't eating enough calories, you aren't eating enough food. If you need more calories, like if rice is available to you, if you need more calories, you eat more rice. If you need more calories and protein, you eat more meat. If you need some more fat for whatever reason, you add some fat. Like literally, you cannot tell me, I mean, because fibrous foods are more filling than non-fibrous foods. And if we're taking out the fibrous foods, then you should have plenty of room to eat plenty of calories. So if you're a person who's going to be like, well, I don't want any more rice, but I'm not eating enough. I don't know how to solve that for you. Like they literally have a diet here where they're underfeeding somebody. They're giving women 1,700 calories a day, and 15% of it's protein. You can fix this. Oh, if you don't know, I really love Macro Factor, the app. It's a calorie and food and macro tracking app. Super easy. It's like one of the best things I've ever done. I've been tracking my food for, I don't know, a month now, and it doesn't feel obsessive. It's super easy. It's not like Chronometer or what the fitness. What's the other one? My Fitness, whatever. Anyway, you can just eat more food. Okay, so there's those references. Again, this is a forbidden food list. They just gave people this. So this is like literally, was this the endometriosis one? No. So they just literally give people this list. Notice how they have initial water flow from the tap, especially in the morning. And red wine and tea and coffee are on there. Now, if you're a coffee drinker, still doing the Love Your Liver program, because I've said this before, coffee is often the last thing that people give up. I'm not sure that coffee is an absolute has to go thing. You might want to check out your electric kettle if you use one. You may want to check out what you're making the coffee in. But if coffee or no was a make or break thing for this, I would just work on figuring out if there's nickel in your coffee, and then, doing your best you can on the rest of the diet. Remember, it's the totality of the diet. It's not just one little thing that changes the diet from 130 micrograms down to 70. Okay, so again, this is another description of the diet in one of the papers. Oh, this is the one with the probiotics that I talk about in the program. So these are what they said. They're going to exclude any food with a nickel concentration higher than 50 micrograms per kilogram. So that was their standard. So if you were in like Nickel Navigator, you could use that standard if they measure it that way. They avoid metal containers. They avoid cooking in iron generally. They avoid storing food in iron containers. And here they're just having people avoid metal containers in general and using glass, Pyrex, Teflon, and unglazed ceramic tableware. Oh, those ceramic coated pots and pans are a bunch of fake BS. It's not ceramic. They call it like a pseudo ceramic, and it comes off. And if it comes off, eventually, where is it going? It's going into your food. It's going into you. So anyway, these were the foods they avoided. And here, let's keep going. Again, this was another study. They were asked to avoid the use of stainless steel utensils, which they meant pots and pans. We call utensils like the things, we mix things with, or, strain things with, and utensils or forks and knives. They were calling utensils pots and pans. And another forbidden foods list. Look here. Nickel containing vitamin supplements. They literally exist. Strong licorice. Oh. Anyway. And I know this study had really good results with the endometriosis women who have irritable bowel syndrome. A lot of theirs, I think I went over this last week, half their symptoms, or all of their symptoms were at least 50% improved after, I think it was 12 weeks of a low nickel diet. Okay, so here's another list. They were saying Western diet stuff that they ate: milk, eggs, all types of meat, fish, refined flour, vegetables, and fruit with low nickel content. So they must have had lists on those were permitted. Instead, beans, legumes, soy, whole grain products were excluded, and the consumption of tomatoes and some vegetables, cauliflower, carrots, onions, spinach, lettuce restricted. Okay. I'm going to go over this paper. I want to hit on this paper. The high prevalence of nickel allergy in an overweight female population. So if you're a lady or a man out there who is overweight, I want you to pay attention to these results that they got from a low nickel diet. Nobody was counting calories. Here's the paper. So this is an observation. In our allergy unit, we incidentally observed that a low nickel diet prescribed for delayed allergy to nickel sulfate reduced body mass index, BMI, and waist circumference in overweight patients. Ladies, especially if you're one of those ladies who is like, I can't do anything to lose weight, or I go on a super low calorie diet and I lose like 3 pounds because you've been doing the yo-yo dieting and now the yo-yo dieting is not working anymore. Or if you're just one of those people who like you honestly say you've watched your calories, you've watched what you eat, and you are not losing weight, this may be it. If you got on, let's say you got on the Love Your Liver program, and you're one of the few people, but it does happen, who gain a significant amount of weight. Could be a nickel problem that we didn't know about. And now we know about it. Okay, so let's just see this. So they had 87 women with a BMI of over 26, which I believe 25 is overweight and 30 is obese. Is that right? Joe, can you check? So mostly females. So it wasn't all females. It was mostly. 43 of them and 2 men showed a nickel allergy and started a low nickel diet. Oh, so they didn't wait. So they had 87 people. 45 of them total had a nickel allergy. After 6 months of dieting, 24 overweight allergic women could be traced, and changes in BMI and waist circumference were calculated. So they only had 24 finish. Prevalence of nickel, this is kind of important. Prevalence of nickel allergy in overweight women was 60%, compared with a prevalence rate of 12.5% in the general population. Wow, does it seem like there's a connection there between nickel allergy, nickel toxicity, and ladies being overweight? A significant reduction in BMI was observed in 24 out of the 43 overweight females with nickel allergy after 24 weeks. So that was 6 months of a low nickel diet. Relative to baseline, the average BMI decrease was 4.2, and the mean decline in waist circumference was 11.7 centimeters. That's 4 inches off their waist. That's visceral fat. That's toxic fat. The BMI going down by 4 points, that's taking somebody from overweight into normal weight. Yeah, overweight is from 25 to 29.9. Obesity is 30 or higher. Okay. So this is taking, on average, they were a BMI of 26. And they're doing a low nickel diet, and they're, on average, they're coming down 4 points. They're going from 26 to 22 on average, and they're losing 4 inches on their waist, and they're not counting calories. If anything, these authors probably made sure they ate a certain amount of calories. So a normocaloric, so they're not dieting. Normocaloric low nickel diet was effective in reducing BMI in this population. Toxicity makes you fat. Have you seen my toxicity and overweight episode? Now we can add a new toxin to it. So if you joined the Love Your Liver program and you started eating lots of oats or barley and beans, maybe you were doing nuts and seeds and you gained some weight you didn't want to, you may have a nickel problem, and we can undo that. Sorry, I didn't know about it sooner. But nobody else is talking about it except this allergy clinic, I guess. Okay, so now we're here. What am I going to do for soluble fiber, Dr. Smith? Because I was talking to Matthew at Good Texture about this. And I said, when I first got into the low nickel diet, I said, how's your pooping? And he was like, it's not great. And I was like, that makes sense. So I very early on thought about it, and I was like, I got to figure out the fibers. And I started the low nickel diet without doing any additional fibers. And yes, I was not pooping as well as I could have. And then I started adding in, what did I add? Well, I have organic Sunfiber around. Don't know if you do, but Sunfiber is a soluble fiber. It feeds the two types of bacteria, lactobacillus and bifido, that are damaged by nickel, decreased by nickel. And it basically feeds the gut. I've been doing apple pectin capsules. I've been doing some glucomannan capsules. Just another option out there, acacia gum. It's similar to Sunfiber, but it's not the same thing. I contacted Sarah Beta. They make barley beta glucan. I'm still waiting on my package. But they said that their barley beta glucan would not exceed, I forget what it was, 0.08 or something. I forget, it was 8 something. And then I think the serving size of the scoop was like 4.4 grams. And so it came out to this. I did the math. It was 3.52 micrograms of nickel per scoop serving, and that is considered low nickel. And I've also been taking some Nutrim, and I'm waiting on their reply about the nickel content. Okay, other nickel diet stuff. Now remember, the main stuff I'm talking about with this is if you just want to do a low nickel diet and then eat whatever the heck else you want. You could do that. You could do that. You know, we found that these other things are problems. So like, here's the idea. As we've been doing all this stuff, reducing your copper toxicity, reducing your vitamin A toxicity may have helped a lot of people with nickel problems. I think we have some testimonials on some of our videos about this now. And some people who have nickel problems, they might have gotten worse having high grains, high beans, because they were already, maybe they're extra slow at getting rid of nickel. Maybe it was just too much for them. Maybe other things happened too. And they just got too much nickel. And that was why they weren't improving. Okay. I'm still going to address, I'm not going to I've talked about how Grant talked about this very early on in the low vitamin A dieting, and I've talked about it a lot, is when people, the researchers talked about it 30, 40 years ago, that it is impossible to make a nutritionally adequate zero vitamin A diet. Like, it doesn't exist unless you eat processed foods. And then they said it's probably going to be nutritionally deficient. And then there's that one story in the literature of the guy who had epilepsy, and he created his own super low vitamin A diet, and his epilepsy went away, but he started getting some eye problems. Well, as I went over in the Matt Stone and eye issues with vitamin A, it probably wasn't from a low vitamin A diet. It was probably from a zinc deficiency, because he made his diet so low in vitamin A. It's like when people start worrying about the vitamin A in beef. Like, seriously, stop it. Stop it. Get some help. Stop worrying about the vitamin A in beef. You never heard me do that once. Anyway, don't go too stupid on this. Like, don't go stupid. Don't do that. There's no such thing as a zero nickel diet. There's no such thing as a zero vitamin A diet. Can we make good diets that are low in these things? Yes. Okay. Nickel Navigator. And if people are if you're going to come at me and you're like obsessing over what Nickel Navigator says about coconut water or whatever, I'm not going to play the game. If you think a food is a nickel issue and you're trying to do a low nickel diet, don't eat it. I can't tell you what type of coconut water you're getting, whether it's high in nickel because Nickel Navigator said it is, or it's low in nickel because Nickel Navigator says it is. That's not the game I'm playing here. If you want to look at the forbidden foods list and just avoid all of those, but those are mostly European based. So they're not talking necessarily about stuff here. A low nickel diet by itself, if that's all you're doing, I think there's lots of places where it could be messed up. Some people say fish and shellfish. Fish is okay on a low nickel diet. And other people say, no, not at all. Well, we already don't eat fish and shellfish, so I'm going to say no. Okay, but this app is free if you want to get it. Here it is. Looks like this. This is the Google Play page for it. I'm not going to the Apple page because screw Apple. Nickels in food. This is an article here where they're talking about, if you know the concentration of the nickel in a food, that may not be very useful in terms of how much is actually in a serving that you eat, right? Like if you're looking at, as she was talking about, like an herbal tea that has maybe a high content of nickel per 100 grams, but nobody uses 100 grams of the tea leaves, and then you're only putting it in water, so it's like it gets way smaller, so it's just calculating the portion. And this was just another example. This one is just another example of the a low nickel diet. So I gave you a bunch of low nickel diets. Is any one of them the one for you? I don't know. Oh, did I not share? Sorry. Here it is. We're back on this one. Still on the same handout. So the other nickel diet stuff. Nickel Navigator's right here. Calculating the portion was this one. Let's see. It was this one. And then the nickel food. This is from Dermatitis Academy. So it's just like a breakfast, lunch, dinner for a week. Now, a lot of those foods we wouldn't eat. So if you're trying to do a love your liver thing and, oh wait, I need to go to the next one. Then we're going to have some other restrictions. Like I said, I'm doing great on this diet. I never thought I'd be on as restrictive a diet as this and be doing just fine. So let's go over what I came up with. I do think manganese is an issue, but I don't think we have to necessarily go super low manganese. So this is the low vitamin A, low nickel, low copper, moderate manganese diet. It's not forever. Pay attention. This is meant to be for 3 months only. After that point, it will be up to you to trial foods and see what you tolerate, particularly if as you choose to add higher nickel foods back in. If you choose to stay on this diet, that is up to you. Low nickel diets are in the literature. Like nobody's falling apart from them in 3 months. Okay? If you think you're falling apart within the first 2 or 3 days and the first week or two, you're dumping. Maybe you're not eating enough. Eat more food then. Get your soluble fiber. There's plenty of places where people can screw this up, just like anything else. User error is rampant. Okay. This is, for those of you who have been on the Love Your Liver program, this is going to look a lot like the Love Your Liver program, except in 2 major ways. One, obviously beans and grains are out for this period. The other one is, I'll get to that. I'm going to explain that very carefully because people are going to take this all sorts of the wrong ways. Okay. Muscle meats, obviously. The best ones, red meats, unprocessed. Well, I should take white off of there. I should just take this off. I think I got that from one of the studies. Red meat and poultry. Now, because we're on a fairly limited diet and it's for a limited amount of time, I have this comment here: avoid or only used for variety or eating out when other options don't exist. So this is like a safety valve. Egg whites. For protein, they do have a high sulfur issue. If you had to have some whole eggs, yes, there's a high sulfur issue in the whites and a vitamin A issue in the yolk. Am I saying to eat them all day, every day? No. But you're on a limited diet here, so you might need some pressure release valves, okay? We are going to continue avoiding organ meats, fish and shellfish entirely. Now we're going to get into starches. This is what you're probably going to replace your oats and beans with. So when I say refined flours, do I mean fortified white flour? No. Don't be like Grant and learn 8 months later that you were eating fortified flour for 8 months, even though it was organic. That's an interesting thing they do in Canada. They require their refined flours to be enriched or fortified. So, unfortified, refined flours and organic. Okay. We've never had any issue with those at all. White rice. Now you can do one of two things. You can buy Lotus Foods rice, which is low arsenic, or you can prep the rice to remove the arsenic. I have a whole live stream on the scientifically demonstrated ways to reduce arsenic in rice. White corn. Organic and nixtamalized is best, obviously non-GMO if it's organic, as used in masa, harina, and tortillas. Tapioca is low nickel. I have no idea how to use this, so don't ask me. I've been doing quite well on some organic unfortified bread I found, and I found some organic unfortified tortillas at Trader Joe's. They are Maria and Ricardo's. That's been my main starch sources. I don't make rice much. You can't bother me to make rice. Not when I got pre-made good bread and pre-made tortillas. I'm just not going to make rice. Okay. Avoid or only used occasionally for variety or eating out when other options don't exist. White potatoes, peeled. They are a nightshade issue. If you eat potatoes every day, you're probably going to get the nightshade issue. It's going to creep up on you. I've talked about this before. But if you have it on occasion, you may tolerate it just fine. Avoiding whole grains and beans and legumes entirely for the first 3-month phase. And I bolded here, you will need to figure out alternative sources of soluble fiber, which I just went over. The fruit list. Apples, pears, green grapes, honeydew or white melon variants, bananas, and berries. Yes, the berries have a polyphenol issue. Don't go stupid on eating berries, okay? But technically they're low nickel. Veggies. There's not a big list here. Cucumbers. I should say peeled. And light green lettuces. I know some of the avoid lists said don't eat lettuces. How much lettuce are you going to eat? Seriously. Avoid or only eat occasionally for variety. Zucchini. Now, zucchini, if you peel it, it may be a lutein issue for some people. Some people are very sensitive to lutein. That makes me want to search lutein and nickel. I'm wondering if that was somebody's issue. Cabbage, green. Let me put on this green cabbage. Cabbage has a sulfur issue. Onions, let's say white onions. Onions have a sulfur issue. Some places say it's high in nickel. Some places say it's not. That's why they're avoid or only used occasionally for variety. Now is the part where some of you folks out there are going to shit the bed and not know what to do with yourself. I'm sorry. I'm going to ask you to maybe get a bag if you're hyperventilating and calm down. You don't have to do anything. Okay, if you are new to the love your liver approach and you know you are very vitamin A toxic, skip the dairy entirely. Are some of you happy now? If you've been doing love your liver for a while and you know you tolerate vitamin A better now, or you tolerate some dairy, then this becomes an option. We're on a very restrictive diet, and this is a very low calcium diet, folks. People do need some calcium. I have a whole calcium live stream for you to listen about that. Here's an interesting thing. Dairy is one of the absolute lowest foods in nickel, copper, and manganese. It does have a vitamin A issue. We all know this. It's also one of the few sources of calcium on this diet for this 3 months when there's extremely little in it or otherwise. Your figs and your white beans are going to be out if you do the low nickel thing. They specifically mention in several of the avoid lists fresh figs and dried figs. If you tolerate dairy and or feel better with more calcium in your diet, then you can add some dairy on your low nickel diet. Here's the limit. We're still not having a high vitamin A diet, folks. Everything else on this diet is low vitamin A. My limitations, I'd suggest limiting any dairy if you do it to about 500 milligrams of calcium and less than 1,000 units of vitamin A per day. This is still a low vitamin A diet. Anybody who says 1,000 units of vitamin A a day is like high. It's not even the RDA. It's low. These are both easily accomplished at the same time. So if you were shooting for 500 milligrams of calcium from the sources I tell you here, you will be at less than 1,000 units of vitamin A per day. As low a possible vitamin A intake is still recommended, and the low nickel phase food list is very limited, hence the added flexibility that I'm doing here. To minimize any issues with dairy, raw is likely the best. Why is that? When they pasteurize dairy, they actually turn it into the more toxic forms of vitamin A, and they're messing with the proteins. Am I becoming a raw milk nerd? No. If raw milk was better, it's not going to be around long anyway. So you better figure out what to do when it's not. So organic, of course. Unfortified, so with no vitamin A or vitamin D3 added. If you want to get the A2 stuff, you can do that. If you want lower vitamin A in it, non-fat or low-fat dairy will have the least vitamin A. Still has some. All the fat in dairy, I've shown this before, there's vitamin A bound to the whey. There's vitamin A bound to the casein. There's vitamin A in the fat. If you take out the fat, you take out the biggest source of it. But there's no dairy that's like zero vitamin A. White cheeses will have less vitamin A than yellow cheeses. The yellow cheeses, they're colored with annatto, which is a carotenoid. Non-stinky cheeses will have less aldehydes than stinky cheeses. So with all of this, this is how you can best pick if you choose to do any dairy, which is limited. You can make good choices. Okay, so the quote-unquote best dairy sources for this low nickel, low vitamin A purposes, if you use them. Milk, I'm not going to touch it. Yogurt. I want you guys to know something about Streptococcus thermophilus. Actually, let me call it what it really is, or the way they'll show it on the label. Wait, I can't change it right now. Yeah, I can. We'll go here. We'll go, where's the bold stuff? There we go. We'll get rid of that there. Okay. Streptococcus thermophilus. If you go and you look at every single yogurt, probiotic cottage cheese, anything, kefir, when I tell you that they're trying to make you suffer and put you in the ground earlier than you should, you're going to understand why in a second. These never used to be in dairy products. These increase the production of 13-cis-retinol. So it takes the trans-retinol, which is the natural stuff, and it turns it into 13-cis-retinol. What does 13-cis-retinol break down to? 13-cis-retinaldehyde and then 13-cis-retinoic acid, which is also known as isotretinoin, which is also known as Accutane. So when they put this probiotic in cultured dairy, they are literally putting a probiotic in there that will make more 13-cis retinol, which when it detoxes in your body, you turn it into Accutane. Let me show you the study, the paper, and show you just how much. And maybe you'll understand why they're doing it. 2008 paper here. Okay. Influence of microorganisms on the retinol isomerization in milk. Among the microorganisms tested in pasteurized milk, the most active in causing an increment in the 13-cis to all trans ratio from 3.4 to 33.4% in 8 hours was Streptococcus thermophilus. Increased the 13-cis to all trans ratio percent by 10 times. They're putting in a bacteria that is basically indirectly feeding you Accutane. What does Accutane do really badly to people? It makes them infertile. What is the male contraceptive pill meant to do? It's meant to stop ALDH, which is part of your detox pathway for vitamin A, so that you build up retinaldehyde and then your balls don't work. Vitamin A is an infertility toxin. Isotretinoin or Accutane is a particularly effective infertility toxin. That's why they tell women to not overdo vitamin A in pregnancy, except for the WAP people who love to have women born with tons of, or babies born with tons of allergies. This is bad. Avoid, you're going to go and you're going to look at every single cultured dairy product in the store, and every single one of them, except I think maybe Nancy's. Nancy's makes some probiotic stuff that I think doesn't have it. Anyway, they're trying to make you eat basically what you will turn into Accutane, and they're trying to sterilize you. Because if you look at the results of Accutane in teenagers, which I've been over before, it's basically sterilizing people. If they do enough of it, or if it affects them in that way. So don't do that. Okay, so what do we got here? We got milk, we got yogurt, we got mozzarella, white cheese, and cottage cheese. Fats. This is pretty straightforward. Naturally refined oils of pretty much any type except for nut oils. Some of you out there are really worried about the seed oils. If you're getting a naturally refined seed oils are yellow because they're full of carotenoids. And apparently nut oils can have a decent amount of nickel in them. If you are getting naturally refined oils and not using them any more than you need to, you're pretty okay. I don't really care. I hardly ever get out the oil here to use it for anything. If you're cooking like ground beef with fat in it, you don't need to add oil to it. It's got tons of fat in it already. Like, what are you doing? Why are you adding more fat to it? If you just cook the beef, the fat comes out of it onto the pan. Now, butter. I mentioned butter here because it is technically low nickel. And as I mentioned here, careful on the 1,000 IUs of vitamin A ceiling if you're eating other dairy. But I have had that butter thing in the Love Your Liver program since I started it. Everybody else was hyperventilating about trying to go zero vitamin A. I never did that. Perfection is the enemy of good enough. All we need to do is reduce our intake of toxins to less than we're able to excrete, and we make progress. Humans have always been exposed to vitamin A. We have methods of detoxing it. That doesn't mean everybody's going to keep up. That doesn't mean it can't be broken by people taking Accutane pills. It doesn't mean that all these healthy eating with like tons of polyphenols can't mess up the whole process. So it doesn't mean it's good for us now. It means that there might be, you calm down on the vitamin A. You keep the vitamin A low. 1,000 units is still low. You get rid of, so you're getting less retinoic acid, less chemical peel. Oh, and the other thing that vitamin A does is vitamin A causes an intracellular cholestasis in the liver. So it means that stuff starts not escaping the liver cells. Intracellular, inside the cell, cholestasis. The bile is getting trapped inside the cells. This causes more copper to get stuck inside the cells. The copper then starts ruining your liver. Your liver starts trying to get rid of these things through the bile. You're dumping the bile into your gut. The retinoic acid literally chemical peels your gut, but the nickel is also causing you leaky gut. So we get rid of enough nickel that you start literally detoxing. You're still detoxing the bile, but now the bile is going into your intestines, which are less leaky. So you don't leak the bile into your blood so much. So you start to feel better. A lot of symptoms start to get better. Who knows? The nickel may be a huge driver of leaky gut. Oh, I got to show you guys the celiac study. You should see how, like, celiacs, a gluten-free diet helps them, but a low nickel diet improved them even more, and a high nickel diet that was gluten-free wrecked them. So if you've been doing a gluten-free diet and still having gut problems, you have a nickel problem, and you should fix that. This is like connecting everything. So where were we? Okay. Well, I'm making better time on this than I thought. So people start going, Dr. Smith, because everybody wants to out supplement, the problem. Okay. You cannot out supplement poisons that are coming in. You can't do it. And if you do, the poison always wins. The poison will catch up and overtake it. Okay. Because you don't accumulate good minerals and good nutrients as much as you accumulate toxins. So that's part of why the toxins always win, is because you accumulate them and you can't get rid of them. So let's go over. I went through the typical nutrients, supplements that we use in the Love Your Liver approach to see how they connected to nickel toxicity. So I do think, this is why I think, folks, if you do the low nickel diet and you've been doing Love Your Liver already, this is going to clear up a lot of stuff. And then you're going to be like, wow, all that stuff's gone. And then you can start figuring out the diet you're going to do after this and what you're going to work back in. If you need to work back anything that you aren't already doing. Like I said, I'm so perfectly pleased with what I'm eating right now. I'm amazed myself. So supplements, magnesium. So these are all the products. If you want to find them, they are linked with the name here. But let's get into this. So let's do the first. We got 4 papers here? Yeah. So nickel and magnesium. When they're talking about transformed cells in culture here, I'm not sure if they're talking about cancer cells. But let's just read these highlighted parts. Nickel and magnesium exert separate and interacting effects on cells. Nickel is toxic, while magnesium enhances the transformation response of transformed cells and protects from heavy metal-induced toxicity. Wow, that's pretty good. Sorry, Sergio Hormoni says barley is okay or not. No, not on a low nickel diet. Maybe afterwards, but it is not okay on a low nickel diet. Whole grains for the low nickel diet are not okay. Remember, this is a temporary thing. But no, not during this. This is like a de-allergy phase. Like you're trying to reduce your body's hyperreactivity to nickel and to get rid of a certain amount of, I think nickel comes out of us pretty fast. We just have to stop exposing ourselves to more than we get rid of. And then nickel's just a huge irritant. That's why, like, as Kelsey brought this up to me, she said, like, think about if you have, let's say, a watch on, or ladies, you have cheap jewelry on, and think of how much that irritates your skin. And then she said, imagine what that's doing in your gut. when you eat it, like a chemical peel, retinoic acid. You put a chemical peel on your face, it like literally dissolves the top layers of skin. Like you can literally see it. It's damaging your skin. A controlled wound. Nickel will cause a literal wound on your skin within hours. Think of what that's doing in your gut when you're eating too much of it every day, whether you're drinking water, whether you're eating foods, and it's too much for your gut cells to handle. So if we can reduce the nickel load, let the healing happen, let the detox happen, then we can start again, and you will know, you will be literally empowered with the knowledge of what nickel does to you, what it did to you and what it does to you. And then if you start feeling that stuff come on again, you could go, ooh, that's a nickel problem. I got to get away from that. Joe said barley's very low in nickel. He made a chart comparing grains. I might look at that, Joe, but I'm not trusting it. This is Joe's doing exactly, Joe and Sergio are doing exactly what I'm talking about. You want to dance around and pick and look at the nickel navigator and do all that stuff and pick your foods that way. That's fine. I like simple. If I'm not eating whole grains and I'm not eating beans for 3 months, then that's what I'm doing. I'm not going to be like barley's okay and oats is not and whole wheat, and I'm not doing that. That's up to you. If let's say you could get a grain that's grown in high nickel soil and a grain that's grown in low nickel soil, and you will never know. The highest fiber foods in the plant world are the ones that accumulate the more nickel in general. So I'm not going to take a chance. I can't tell you if some of the things that have improved now that I've started to come out of the nickel dumping, I never want to go back to eating that stuff again. If this is true and real, I have no attachment to eating those things again. Like I used to wonder, why do I get so bloated on all these high soluble fiber foods? I don't think it's bile anymore. I don't think it was bile dumping. I think my reaction was nickel based on the inulin and the Jerusalem artichoke fact that those have more nickel than anything. So anyway, nickel was expected to decrease the transformation frequency. That's the bad thing. And did so in 6 of the 16 cases. Magnesium was expected to enhance the transformation frequency independently of nickel. Magnesium increased the transformation frequency values in 7 of 16 cases. That's good. The nickel-magnesium interaction occurred in 11 of 16 cases. So magnesium was protective of nickel stuff, is what they're saying there. I am not a robot. Thank you, Cloudflare. Wait a second. Is this the right link? Hold on. There we go. Yeah. Oh, I got to refresh this. There we go. Yeah, research progress on the effects of nickel on hormone secretion in the endocrine axis and on target organs. Let me jump down to where it was. The carcinogenic activity of nickel may occur in part through the displacement of magnesium from its cellular functional sites, as the action of nickel appears to involve substitution of magnesium bound to phosphate moieties of DNA and nucleotides. Nickel kicking out magnesium. Gosh, have I talked about minerals kicking each other out before? Now my buddy, he does some biofeedback stuff on himself, and he was saying he can't understand why right now, as he's going through his nickel dumping, he's like, why is my body asking for 10 pumps of mag lotion a day? I said, well, you didn't take any for a long time. And at the time I didn't know, but now I'd say, oh, here it is. You're displacing magnesium. You're displacing nickel by taking the magnesium. Your body wants the magnesium to fill these slots. The carcinogenic activity of nickel may be from kicking out magnesium. Isn't that interesting? Let's do this one. Come on. Why is it not showing me the... Oh. Well, it's not highlighting it. Okay. Magnesium is an effective protector against nickel-induced carcinogenesis in vivo. So that's in animals or humans, probably animals, although its mechanisms of protection remain elusive. The effects of magnesium carbonate, like one of the crappiest forms of magnesium, on the cell toxicity and the DNA toxicity induced by nickel subsulfide were examined with respect to the inhibition of cell proliferation, micronuclei formation, DNA protein cross-link formation, and intranuclear nickel concentration. What did they find? The cellular accumulation of nickel increased 80-fold with nickel subsulfide treatment and decreased with magnesium carbonate treatment. Magnesium decreased the amount of nickel. These results suggest that the protective role of magnesium in nickel-induced cytotoxicity and genotoxicity can be attributed to its ability to reduce either the intracellular nickel concentration or reactive oxygen formation. Magnesium literally detoxes nickel. But again, if you rely only on the supplements, so effects of essential divalent metals on carcinogenicity and metabolism of nickel and cadmium. This has an interesting paper. There's some interesting stuff in here. Interactions between the physiologically essential metals calcium, magnesium, and zinc and the carcinogenic metals nickel and cadmium were investigated to help elucidate the mechanisms of action of the carcinogenic metals. Bioassay studies revealed several significant findings, including 1, the ability of magnesium and calcium to inhibit nickel-induced elevation of pulmonary adenoma incidence in strain A mice. 2, the ability of magnesium, but not of calcium, to prevent cadmium-induced subcutaneous sarcoma formation. And 3, the ability of magnesium, but not of calcium, to inhibit nickel-induced muscle tumor formation. Biochemical studies indicated a direct relationship between the anti-tumorigenic potential of magnesium and the capacity of this metal to 1, inhibit nickel and cadmium uptake by the targeted tissues in vivo. So you get enough magnesium in you, it's going to decrease nickel and cadmium uptake by the tissues. Inhibit nickel-induced disturbances in DNA synthesis in vivo, in actual animals. Inhibit nuclear and cytosolic uptake of nickel by the target tissue cells in vivo. And 4, inhibit nickel and cadmium binding to DNA in vitro. Calcium, which in most cases did not prevent carcinogenesis, had no consistent influence on the uptake of carcinogenic metals or their biochemical effects in the target tissues. Magnesium and zinc, but not calcium, were also found to attenuate or reduce the acute toxic effects of nickel, indicating a possible correlation between prevention of acute effects and reduction in tumorigenicity. Zinc, which antagonizes cadmium tumorigenicity in the rat testes, zinc prevents you from getting cadmium cancer in your balls, guys, was found to reduce markedly cadmium uptake into isolated testicular interstitial cells. Also, zinc was found to inhibit strongly cadmium binding to DNA in vitro. So, this was kind of a zinc, this is a magnesium study, but it's also a zinc study. Now, I do want to say, for those of you out there who are still watching this out of hate or whatever, you're out there hate watching me. Hello. Hi. How are you doing? I do want to say that some of you taking ungodly amounts of calcium, your benefits from it may simply be from blocking nickel. When Matthew Good Texture was taking up to 400 milligrams of zinc a day, he figured out that he might have simply been blocking nickel absorption. So you can take ungodly amounts of things and block things. And that could be what people were thinking was the effect. Is it good to take ungodly amounts of zinc or calcium? No, that's a drug effect. Why don't we take the poison out? That's what I'm going to suggest here. And then we figure out what you need later. Because removing the poison removes the need for the mega dosing and the covering it up like a drug effect. So there's that. And then what was this one? Oh, zinc sulfate treatment of nickel sulfate positive patients. They're treating nickel allergy. Oh, we're into zinc now. Sorry, we're into zinc. Oh, Joe, I'll get to that. Sorry. So that was the magnesium. So zinc. Now, how do we carry zinc? We carry zinc individually, and we also have it in our keystone minerals, our flagship multi-mineral. Remember, they call them multivitamins because they don't have crap worth of minerals in them. We make a multi-mineral of the actually important minerals. We're not putting copper in our multi-mineral. We're not putting manganese in our multi-mineral. We're not putting nickel in our multi-mineral. We're not putting calcium in our multi-mineral. So anyway, zinc sulfate treatment of nickel sulfate positive patients. Zinc sulfate treatment improved the clinical manifestations and abolished, as in destroyed or reduced, the majority of patch test reactions, the nickel patch test. Sorry, Joe, I keep forgetting to share this one. So zinc sulfate treatment got rid of the irritation from the nickel patch test. Okay? Where they put nickel on them, it irritated their skin. Zinc sulfate got rid of it. Okay, let's keep going. Now, these are, okay, so I'm going to just state what's going on. These are plant studies. Minerals are kind of minerals. So I'm just going to show you in multiple plant species. We just saw in, I think that was a rat study, where magnesium displaced nickel. And now we're into zinc displacing nickel. So if you've ever been iron deficient, like ferritin deficient, you're probably nickel toxic. And if you've ever been significantly zinc deficient, which is pretty much everybody, you're probably got some nickel toxicity issues. That's why I'm so excited about this being able to help so many people with stuff that you never thought was connected. I never thought it was connected until I started doing it. In this plant, Arabidopsis thaliana, the iron transporter, iron regulated transporter 1, mediates iron uptake and also implicates in nickel uptake at the roots. So again, it's a divalent cation, iron and zinc using the same transporter. Okay. We found that zinc deficient conditions resulted in increased accumulation of nickel in plants. Iron deficiency results in increased nickel. Zinc deficiency results in increased nickel. Zinc deficiency induces short-term nickel absorption, and zinc inhibits nickel uptake, suggesting competitive uptake between nickel and zinc. Furthermore, the ZRT, IRT-like protein 3, defective mutant plant with an elevated zinc deficient response, so it has an even stronger zinc deficient response, exhibited even higher nickel accumulation than the wild type, further supporting that the response to zinc deficiency induces nickel accumulation. So for those of you who, let's say, it is quite possible, those of you who are very sensitive to zinc or selenium even, you may be very toxic in nickel, and that they could be stirring up copper, it could be stirring up nickel. The good news is once you do the low nickel diet for long enough, there won't be any more nickel to stir up, and then that goes away. These suggest that zinc deficiency induces nickel accumulation in an IRT1 independent manner, so it's not related to iron. The present study revealed that nickel accumulation is inducible in response to a zinc deficiency, which may be attributable to a zinc uptake transporter induced by zinc deficiency. So they're saying the zinc transporter gets upregulated because there's a zinc deficiency, the plant wants it, and then it grabs onto more nickel. Okay, another plant from the brassica species, which is your good old cruciferous vegetables, your broccoli, Brussels sprouts, cabbage, cauliflower, and you kept seeing broccoli on all those the high nickel lists. The nickel hyperaccumulator, Odontorrhea chalcidica of the brassica family, preferentially takes up zinc over nickel. So these plants accumulated high concentrations of zinc in their roots. Zinc uptake was not influenced by nickel, but nickel uptake was severely suppressed by zinc, dropped by 87.4%, while nickel uptake was significantly stimulated by zinc deficiency and increased by 30.4%. We had Matthew at Good Texture taking crazy amounts of zinc some days. He didn't do that every day, but he was doing crazy amounts of zinc, and he saw his eczema get better that had previously not responded to a low vitamin A diet. So then what can we assume the zinc was affecting? His nickel uptake. So he was, in a certain way, putting himself on a low nickel diet because he was absorbing less nickel from his food. And probably correcting any zinc deficiency he had, but that was probably corrected pretty quick at those doses. So am I saying if you decide to go out there, I talked to Matthew about it. I was like, if you start getting messed up, like, you should stop that zinc. And he's like, I think he basically said, I know. And I was like, okay, cool. As long as we're on the same page, like, if you want to be the experimenter, go ahead. If any of you out there go and start taking mega doses of zinc and you mess yourself up, I want you to know from the very beginning that I'm saying I think it's a bad idea as a general rule. There is such a thing as excess zinc. If you decide to go in FAFO, that's on you. Just because I told that story doesn't mean I'm endorsing it. Okay. Conclusions. And I do want to say I'm very grateful to my conversations with Matthew. They have been helpful. And yeah, it's just like Matt Stone doing his, like, trying to get his vitamin A diet as low as possible. And then he develops a zinc deficiency. And then he gets problems from a zinc deficiency. Okay. Well, if Matthew develops issues, he learned something. I mean, what did Matt Stone learn? His symptoms were all the symptoms he associated with vitamin A toxicity were all better, but he created a new symptom with a deficiency. Well, the thing I'm concerned about with Matthew is he may be fixing one thing while potentially creating another thing, an excess of zinc. So we're trying to be, my goal for you guys and for people who never talk to me is to give you sane stuff to do, not to go to the limits. So, calcitica preferentially takes up zinc over nickel, probably via relatively high affinity transporters, whilst nickel uptake is via a broader range of transporters, and the zinc transporters appear to be part of the nickel transport systems. Your body is not super selective. It will grab on to all sorts of stuff. This is why it's better to not have the poison be there. As the saying goes, if you wouldn't put it in your mouth, don't put it on your skin. Nickel ions influence the transepithelial sodium transport in the trachea, intestines, and skin. I don't know if I marked this one. Hold on. There it is. This is just the quick thing I wanted to get. In the digestive tract, nickel ions are transported by the divalent metal transporter 1. This is the same one that transports iron, thus preventing the absorption of important micronutrient metals, including iron, zinc, and copper ions. I'm really starting to wonder, with the whole thing we talked about with the low ferritin and the zinc interfering with that, interfering with restoring it. I really think that the nickel is the linchpin in that whole thing, because they were looking at iron and zinc, but they weren't looking at nickel at all. And it was a study on young women, not young men. I don't know. Anyway, I think if you got low ferritin, the most important thing you can do is getting rid of the nickel and then restoring the iron. And zinc may come later. Okay, what are we at? Are we still on zinc? Oh, no, we're into selenium. Okay, so let me go back. So that's zinc. Now we're going to talk about selenium. Recent smear article. What a joke. Selenium, either individually or it's also in keystone minerals. I put it there because selenium, zinc, and molybdenum are really, really important minerals, and they're just not in the food. So let's look at selenium real quick. Role of selenoprotein. Gosh, do you think that has selenium in it? Selenoprotein? M knockdown in the melatonin antagonism of nickel-induced apoptosis and endoplasmic reticulum stress in mouse heart. I think I went over this in the other week. Overall, the findings suggested that the antioxidant capacity of selenoprotein M, as well as its modulation or control over endoplasmic reticulum stress and apoptosis, plays important roles in nickel-induced heart injury. So it helped. When they knocked out the selenoprotein M, they had problems. And another selenium one. Ladies, listen up. Protective effects of selenium and zinc against nickel chloride-induced hormonal changes and oxidative damage in the thyroid of pregnant rats. Okay, pregnant rats. Pregnancy is when you get kind of the most cholestasis and toxic bile problems, and you're just spitting, ladies, you're just spitting your toxic bile back into your blood. Copper levels go off the charts. Vitamin A levels go up. Like, that's why you feel crappy when you're pregnant, is like you're dumping your toxicity right back into yourself. And we have lots of women with thyroid stuff. And I'm telling you, ladies who have not gotten any better with other stuff, your thyroid stuff, I'm almost positive is related to nickel. We see a lot of patterns of, let's say, older women. Okay, so we have two things there. Older, age. Nickel problems go up with age. Women have more nickel problems. We're right here, we're looking at thyroid. A lot of these older women have weight gain, they have thyroid issues, and they also get low ferritin. This is a connecting piece, I think, that everybody's missing out on. Nickel chloride is a heavy metal that may affect the function of the thyroid. Selenium and zinc are essential trace elements involved in thyroid hormone metabolism. Results showed that nickel chloride exposure caused a significant decrease in maternal body weight and an increase in absolute and relative thyroid weight compared to the controls. That's not a good thing. Nickel chloride administration also led to decreased T3 and T4 with a concomitant significant increase in thyroid stimulating hormone levels when compared with that of control. So nickel chloride was making them hypothyroid. In addition, an overall pro-oxidant effect was associated with a decrease. So the nickel animals made less glutathione and non-protein thiol contents and the enzymatic activity of glutathione peroxidase. They're making less glutathione and superoxide dismutase, and an increase in malondialdehyde, which is super toxic, the fatty acid aldehyde. These biochemical disturbances that they measured were confirmed by histological changes that they could see. However, the co-treatment of selenium and or zinc chloride attenuates or reduces nickel chloride-induced changes. Our findings suggest that selenium and zinc chloride ameliorated or made less nickel chloride-induced thyroid toxicity in pregnant Wistar rats by exhibiting antioxidant effects. It's not just antioxidants. Like when they attribute minerals with just an antioxidant effect, this is just they're trying to keep the antioxidant theory alive. You literally need minerals. They're like the spark plugs of your body. It's not just, oh, it's an antioxidant. No. So I think that was it for selenium. Let's go back here. Oh, flesh niacin. I'm going to go over this more. Well, or maybe I could save this. I'm going to go over it anyway, but I want to give Kelsey her time to shine. But one of the things I want you to know is, folks, if you have GERD or reflux or ulcers or H. pylori or any of that stuff, you have a nickel problem. H. pylori cannot become a problem or virulent until it has enough nickel. Like it's in the research. It has to have nickel to become virulent or a problem. So if you have GERD, reflux, H. pylori, ulcers, you have a nickel problem. And a low nickel diet, you should go and read the nickel allergy section of Reddit. There's people saying they've had GERD for 30 or 40 years and all of a sudden it goes away on a low nickel diet. Serious. Now, what I'm about to go over is Kelsey and I looked and we couldn't find anything connecting nicotinic acid or flush niacin with nickel directly. Okay. Flush niacin is like the gasoline for your detox systems, though. So what Kelsey found was this paper. Let me find it. There we go. And this paper is going to show us two things: the association between dietary niacin intake and Helicobacter pylori seropositivity, or showing up with positive in the blood for H. pylori in U.S. adults, a cross-sectional study. Let's go find it. Moreover, a nonlinear L-shaped relationship emerged between niacin intake and H. pylori seropositivity, indicating minimal risk of H. pylori infection at approximately 44.69 milligrams of niacin per day in the diet. Let me get to the next one. Conclusion: the study suggests a potential link between increased dietary niacin intake and reduced prevalence of H. pylori seropositivity. This correlation is bolstered by plausible mechanisms involving immunomodulatory function, mitochondrial dysfunction, and cellular oxidative stress. Well, let's just review. Nickel causes oxidative stress. We already went over in the last live stream. Nickel causes mitochondrial dysfunction. Nickel causes an immune system problem. Okay, so the plausible mechanisms can all be connected to nickel. And we see that when there's more niacin in the diet, 45 milligrams a day, there is a drastically lower rate of H. pylori positive tests in the blood. I'm telling you, GERD, H. pylori, reflux, and all that stuff is connected to nickel. Flush niacin, when people got enough of it, or niacin in general, when they got enough of it, they didn't have issues with H. pylori. 45 milligrams a day, like we make a 25 milligram flush niacin. So for those of you out there who are wondering, is 25 milligrams of flush niacin enough? Yes. Most of the benefits, think of like the 80-20 rule. Like you get 80% of the benefits from the 20% of the first investment that you put into something. So 25 milligrams is a really good place to start. The Keystone Minerals plus niacin now has 200 milligrams of flush niacin in it. You can go crazy. We're working on the niasoda, the buffered flush niacin, to come out soon. Oops, wait. But anyway, like you don't have to take mega doses of flush niacin. This is what we wanted to get at. So if you're just going to take a 25 milligram flush niacin pill a day to make sure you cover your bases, great. That works. So this was the connection. Actually, while we're here, I'm going to jump to the lactoferrin part. Let me find it. I'm going to jump ahead. So here we're going to connect lactoferrin and nickel. Okay, so here's something that I've told people before, as I say right here. Do not take lactoferrin if you have GERD. Fix your nickel toxicity first. What we have observed over and over is that if somebody comes to us and they have reflux, GERD, heartburn, and they take any amount of lactoferrin, it fires it up. Fires it up. Like they just can't take lactoferrin. If they keep trying to take lactoferrin, the GERD just keeps coming. It's just an observation. Does that mean lactoferrin's bad for them? Well, it's doing something. Well, let's go look at Crypt. Did I open this? Yeah, there we go. I just looked up nickel and lactoferrin. Cryptic domains of a 60 kilodalton heat shock protein of Helicobacter pylori bound to bovine lactoferrin. So they literally say here, bovine lactoferrin binds to a heat shock protein of H. pylori. What does that mean? I don't know. They interact. That's what I know it means here. They're binding to each other. Now let's go to the next one. Come on. I did. I clicked. Okay. Lactoferrin, myeloperoxidase, lysozyme, and eosinophil cationic protein in exudate, as in like the cellular, the fluid leaking out in delayed type hypersensitivity. Well, that's exactly what nickel allergy is. It's delayed type hypersensitivity. Further, we studied the kinetics of the leukocyte granule proteins, lactoferrin. So your white blood cell literally makes lactoferrin, myeloperoxidase, lysozyme, and eosinophil cationic protein in the exudate fluid in a parallel test. A significant higher flux, so more was pushing out, was found for all of those during the second day of allergen exposure compared to contact allergic patients without allergen challenge, as well as normal volunteers. So the allergic folks pushed out more lactoferrin and these other proteins when they were when they were exposed to nickel. Was nickel in here? Oh no, this was just connecting lactoferrin and yeah, there it was. It was nickel. A skin window technique was used to study the morphology of leukocytes in upper dermis and exudate during nickel challenge in patients with contact allergy to nickel. So when they were exposed to nickel, the nickel allergy people made more lactoferrin. So I don't know how to interpret all of this. All I know is that we know that nickel's connected to H. pylori and reflux. We know that flush niacin helps with reflux and H. pylori. Now we have lactoferrin spikes up in people who are sensitive to nickel. Lactoferrin binds to a heat shock protein that's part of H. pylori. We know that people with reflux cannot take lactoferrin. They can take it after the reflux is gone, but what would that mean also? That the nickel issue is gone enough. So it was just an interesting connection. So again, what I'm saying for you folks is I think a lot of you who are really hypersensitive to a lot of supplements, you have nickel toxicity or copper toxicity, but I think the nickel is the part we weren't dealing with. And zinc is the biggest reactor that people have. Could it be copper? Sure. Could it be nickel? Well, we'll know if we see a bunch of people who do a low nickel diet and then they try taking the zinc supplement again and they're fine, then we know it was a nickel problem. So you guys can help me with some of these reports that you'll have. I've always tolerated zinc just fine, so I'm not going to be a good investigator of this. So, okay, so that was the nickel and lactoferrin connection. Okay, zeolite. Let's go into zeolite. Here we are. Zeolite and bentonite as nickel sequestrants, as in they literally grab onto nickel in carbonation lime coming from the sugar industry. If zeolite grabs onto something in water or in lime, then it grabs onto it in your gut. Okay. The results show a noticeable reduction in water-soluble and bioavailable nickel in lime after the addition of sequestrants, especially at the dose of 5% bentonite or 5% zeolite. Got that one. Mitigation, or as in relief or improving of nickel toxicity and growth promotion in sesame through the application of a bacterial endophyte and zeolite in nickel-contaminated soil. Present research work was conducted to evaluate the potential effects of an endophytic bacterium Colobacter species MN13 in combination with zeolite on the physiology, growth, quality, and yield of sesame plant under normal and nickel-stressed conditions through the possible reduction of nickel uptake. Surface sterilized sesame seeds were sown in pots filled with artificially nickel-contaminated soil amended with zeolite. I believe they also put in the bacterium. Results revealed that plant agronomic attributes such as shoot root dry weight, total number of pods, and 1,000 grains weight were increased by 41%, 45%, 54%, and 65% respectively over the control treatment with combined application of bacteria and zeolite in the nickel-contaminated soil. So yes, zeolite binds to nickel. And I can tell you that when I've taken my detox sludge, as I call it, which contains zeolite and charcoal and niacin and other things, during this detox dumping phase, I did feel noticeably better. I've been reminding Kelsey to do it too, when she's not feeling great through it. I'm so excited for this to all, just this early phase to be over. Okay, so now let's go into Sunfiber. Sunfiber is partially hydrolyzed guar gum. So it's not guar gum per se. It is the fiber from guar gum, basically hydrolyzed, chopped up a little bit. Like if you think of collagen, I believe collagen is hydrolyzed. So it's nothing crazy, hydro water, right? But it's partially hydrolyzed. So they broke down the guar gum a little bit. So it's easier to digest. Straight guar gum can be too much for the gut. Partially hydrolyzed guar gum, Sunfiber, very well tolerated. So let's just hit on this. This is the paper, folks, that I talk about in the probiotics section of the Love Your Liver program. What is Sunfiber? Well, it helps to feed both lactobacillus and bifidobacterium, and nickel toxicity negatively affects one or both. Like in this paper here, probiotic supplementation in systemic nickel allergy syndrome patients. So they're already sick. Study of its effects on lactic acid bacteria population and on clinical symptoms. So what they did in this paper, these people were already nickel allergy toxic, and I think they gave them some more nickel. I think they actually gave them some extra, or they just did the patch test on them. Then they looked at their gut. They looked at indole and scatol, and they were trying to classify them as fermentative and putrefactive or a mixed type. And based on those measurements, they came up with that. And then what they did was they put them on a low nickel diet, and they gave them the probiotic that was indicated for their type. Like the fermentative got the lactobacillus. The putrefactive got the bifido. And then there was the mixed type. I think it was something crazy like 80% of them or more, 85% were fermentative, and some small 2% were mixed. No, 2% were putrefactive and the rest were mixed, or so. It's something like that. It's almost all fermentative, a little teeny bit of putrefactive, and mixed. And so they gave them either the fermentative got lactobacillus, the putrefactive got bifido, the mixed got a mix. And they even tell you the brand of the probiotic. They're European brands. I don't know if you're going to have an easy time getting them, but they helped the lactobacillus to improve. Oh, so what they saw was the low nickel diet improved the gut biome in pretty much everybody. Didn't fix it, but it improved it. When they gave them the right probiotic for their type, it improved it even more. Okay. So what can you do to put the food down there for the lactobacillus to grow, or the bifidobacterium to grow, or both? Well, that's specifically what Sunfiber does in the literature. Okay. Now, I want to add some other things on this. Let's see. What was it? Partially hydrolyzed. There we go. So partially hydrolyzed guar gum increases ferroportin expression in the colon of anemic growing rats. So I take Sunfiber, and I've tended towards having a bit too much iron. I'm not going to stop taking it because of this paper. These rats were starved of iron. If you are, let's say, one of my people with low ferritin and a nickel problem, you may want to pay attention to this study about Sunfiber. So they male Wistar rats, they got a rat diet for growth, pregnancy, and lactation without iron. So I believe they gave them no iron for 3 weeks in order to induce iron deficiency anemia. So they gave them iron deficiency on purpose. Then they were fed a control diet without fiber, or a diet with 7.5% of Sunfiber, basically, both without iron. The intake of Sunfiber reduced food intake without affecting body growth. Okay, so they ate less food, but they stayed the same size. They're more efficient. Their digestion is better. And there was a difference between the groups regarding the food efficiency constant, I believe, food efficiency coefficient, feed efficiency coefficient. There it is right there. With the highest value found in the PHGG group, the Sunfiber group. So that means the Sunfiber group was turning food into tissue the most efficiently, so they could eat slightly less and still be the same size. This would be like getting more miles to the gallon in your car, which would be nice right now, right? The same amount of gas gets you further. The same amount of food built more tissue, or you could say the same amount of tissue required less food. PHGG seems to have a positive influence on iron absorption through transporter expression. So these were purposely induced iron deficiency anemia animals. And then they're seeing Sunfiber helped with the iron absorption to get them back to normal, to move them towards normal. Okay, now we're in here. Another Sunfiber paper. Let me make this a little bigger. Ingestion of guar gum hydrolysate, that's PHGG, partially restores calcium absorption in the large intestine, lowered by suppression of gastric acid secretion in rats. So they messed up these rats. Oh, they gave them 2 injection groups, omeprazole and vehicle. So yeah, they gave them a stomach acid inhibiting medication. Apparent magnesium absorption was clearly lower in cecectomized rats than in sham-operated rats. So the rats who had part of their intestine taken out absorbed magnesium less well. That makes sense. Magnesium absorption was higher in the Sunfiber fed groups than in the groups fed on the Sunfiber free diet. Wow, so they're getting more magnesium. Magnesium helps with nickel. That's a good connection. Even in the case of cecectomized rats. So magnesium absorption was higher in the Sunfiber rats, even if they had their cecum removed, part of their intestines removed. We conclude that calcium absorption lowered by inhibition of gastric acid secretion is partially restored. So they gave them the med, partially restored in rats fed with Sunfiber, but the increment is not sufficient to meet requirements. So it's restoring their proper absorption of their gut, even though they were given a stomach acid nasty thing like omeprazole, which has been shown to shorten your life. It's literally been shown to shorten people's lives and increase disease in people. Omeprazole. It's an azole med. Gosh, what are they pushing right now along with ivermectin? Azole meds. They are not your friend. There is no magical pharmaceutical cure coming for you. Peptides. Dude, I've been watching so much stuff on peptides lately. Peptides they might help. And they're an absolute psyop to move you towards transhumanism. So you can just pick something. I want to fix this part of me. It's like, think of like Star Wars when they're fixing C-3PO. Oh, I need this piece to fix myself. Like, oh, I'll just get this peptide. I'll fix this. Oh, I'll just get this peptide. I'll fix this. It is absolutely moving you towards the mindset. They're just going to put new parts in you next. Yeah. And as somebody was going over all the beeps around us, like all the beeps in your car is training you like an animal. You hear the beep. Oh, I did something wrong. You hear the beep. Oh, I did something wrong. Like, oh, the seatbelt beeper is going off. Oh, I got to put on my seatbelt. They're training you like a dog. That made so much sense to me. And I was like, why do I hate those beeps so much? As opposed to the people who can constantly listen to a beep and not get upset by it. Oh, this is one probiotic. So let me go back here. So there was one probiotic studied in relationship to nickel. It is this probiotic. I don't carry it, but I wanted to tell you about it anyway. I have the links to Amazon here. So let's go back to that one. Where was it? Probiotic supplement. This is it. Yes. Probiotic supplementation in systemic nickel allergy syndrome patients, study of its effects on lactic acid bacteria population and on clinical symptoms. So I want you to be clear here. The amount of the lactic acid bacteria population is not, it doesn't mean anything improved. Okay, so you got more lactic acid bacteria, but does that mean anything improved per se? We are interested in the clinical symptoms. So again, they specifically mention it's not just any Lactobacillus reuteri, it's this one. If you want to see the product here, I'll go show that right now. This is the one product that I know has it, this BioGaia, and the link's in the document. Okay, so where were we? We're back here. So anyway, they saw an increase. So they saw an increase in biodiversity in the gut of patients supplemented with the Lactobacillus reuteri strain. In addition, GI reactions such as symptoms related to meals and type of stools significantly improved only in patients treated with Lactobacillus reuteri. They were doing a low nickel diet. While severity and frequency of cutaneous symptoms, skin symptoms, or urticarious itch or urticarious rash, itching, and eczema, and recurrent abdominal pain, as well as VAS scores. I don't think they had I forget what that was. Oh, the patient's clinical condition perception statistically decreased in both groups. So they saw the gut biome improve. And remember, I told you in that other paper, the lactobacillus fermentative type was like 80 to 85% of the people with systemic nickel allergy syndrome, which again, women tend to be fermentative more. Women tend to get more nickel toxicity. They didn't put a number in here of how many patients were in this. But anyway, so they saw the gastrointestinal reactions related to meals and the types of stools only improved in the patients treated with Lactobacillus reuteri, whereas a lot of other symptoms improved in everybody who did the low nickel diet. How long did they do it for? I don't think it says. Anyway, our preliminary findings suggest that the probiotic Lactobacillus reuteri could be a useful supplementation during a low nickel diet of patients with systemic nickel allergy syndrome to increase the lactic acid bacteria population diversity, which could contribute to restore the intestinal homeostasis conditions. I told Kelsey about that probiotic yesterday, and she goes, I'm ordering it. And I was like, okay. And we connected the nickel thing. So that's basically... Okay, somebody give me a grade on my research project. How was my research project? Anyway, let me find my camera window. There we are. Let me pull up the chat. And where is it? There it is. Okay, let me move this over here so I can see it without looking too far away from the camera. Baptizing Fire said, remind me to check the smoke alarm. What do you mean? The beep? The beep that some people can just listen to? I know somebody personally who can literally drive their car with the seatbelt beeper constantly going. They can drive. I don't understand how it works. Oh, I'll be insanity said it's too good. You clearly used AI. I'm going to say I used AI to search for some of it. To search. Can you believe I have to tell AI multiple times, give me the links, like give me the literal links to these studies. It'll just talk at me like, just believe me. And I'm like, I'm just using you as a search engine. Give me the link. It can be a helpful search engine. Okay. Oh, thanks, Joe, for the A+. Oh, Sergio says, I give BioGaia to your daughter when she's sick. Well, okay. If you give it to her when she's sick and it helps, that may indicate that her sickness may be nickel. And she's a woman, or she's a female, so it's more likely. if she got earrings, like I just kept hearing about, one of the things, now I'm remembering one of the things that Julie got in some of the early lactoferrin days was she got this cough. She was like, I just can't get rid of this cough. And I was like, I finally figured out to tell her to stop the lactoferrin, but now I'm going nickel. If you're one of the people on the program where you're getting this little cold and it's like a cough, it's nickel. I'm positive of it. So, and again, for those of you who are worried about the testing, what can I do to test and see if I'm nickel toxic? You know, what's free is doing the diet. You're going to eat anyway. And this diet would probably reduce some of your food bills. If you see, we do testing for vitamin A. Do I need a vitamin A blood test to tell anybody that they're going to feel better if they reduce their vitamin A intake? I don't need a test to tell people that. I could do, if I want the tests I need the most. The basic hair test has magnesium and zinc and the toxic things, really, folks, like what we're talking about on that sheet, the diet, the low vitamin A, low nickel, low copper, low manganese. Do I literally need any tests for those to believe and know that if people eat that way, they're going to feel better? I don't need any test. Did I test myself for nickel before I jumped in on this? No, I didn't care. I was just like, I'm going to dive in. Like that's what I do. And so those of you who dive in and then you're like, why do I feel like crap? You dove in, like you did it. I didn't do it. You did it. I'm sitting here telling you, if you dove in and you felt bad, we know why now. And if you dive in now after this, you should know why. You shouldn't go around asking. Kelsey told me yesterday, she said in office hours, a mom came and told her that since they started the low nickel diet, like her and her child got depression symptoms. Kelsey's even telling me she's got a little bit of depression right now and her cycle's shifting. And I'm like, it's all nickel. It's all nickel. I'm positive. There's nothing changes that fast unless the body dumps toxins or you take in toxins. So what I'm just saying is, like, the mistake would be like, some people might think, oh, I did the patch test on my skin and it didn't come up positive, so I don't have a nickel problem. What if you do, and you're one of the few people who doesn't have the nickel patch test positive, but you decide based on a test that you don't have a problem, and that was the one answer you needed? You did it to yourself. So like I said, the hair test may be suppressed. Taking in nickel may suppress nickel detox on the hair test, right? I mean, like I said, people go off the nickel, they start dumping tons of it. We see it in their symptoms. So what about people consuming more nickel than their body can handle? Well, if not eating nickel induces detox, then eating nickel would suppress detox. So again, we're waiting to see what happens. I guess my hair test is probably gonna be the first one. And we'll see. We'll see if all of a sudden I see nickel go like way up or off the charts, then we'll know that the hair test is valid, but only after people do a low nickel diet. This is something, it's known in the hair testing community by those who understand it, that like suppressing detox means things don't show up on the hair test. Just like I told you about mercury. Sometimes it comes out and sometimes it doesn't. And sometimes it comes out, and then when you take it out, it like goes off the chart and it finally starts dumping. So you could be dumping some, but there could be like an iceberg worth of the iceberg underneath the water just waiting to come out. So that's why, I mean, when people put value judgments on hair tests and their value, I go, I I'm sure that most people out there don't understand the hair test as well as I do. And I go, and if I'm saying, I don't know, let's wait and find out, then I think it's probably a pretty good idea to wait and find out. So, like I said about the mercury thing with people eating fish, and all of a sudden their mercury pops up later when they finally stop, when they get the fillings out of their mouth. Oh, and if you have like, there's nickel in mercury fillings, I believe. Now there's copper and mercury and nickel. Get those. And so if somebody said, well, I don't see nickel on my hair test, I'm like, you got nickel in your mouth every day, shutting it down. You got a retainer, shutting it down. Like we see people dump the stuff that's in orthodontics 30 years later on their hair test when they finally start doing the right things. I don't know. I guess I could go back through all of my old hair tests and see if that ever happened for me. Okay. So yeah. So, Joe, did I miss any super chats? Let me look. But so if you bought a bunch of like grains, you know, I know that there's always like, I'm not saying you have to throw away everything in your pantry. I am saying that if you want to do the low nickel diet right, I'm going to suggest that you're a bit more restrictive rather than less restrictive. Because if you're just like, well, Nickel Navigator says barley's okay, and you decide to eat a bunch of barley. And here we got Sergio, you're saying your daughter gets a cough and you give her the probiotic that seems to help with nickel stuff when she's sick. And you're telling me that you eat barley and white rice often or regularly. And Joe's saying that barley's low in nickel based on what his research said. And I'm going, I don't trust it. Then we start looking at the real world results and we go, does this all connect? Are we ever going to know? Can we look at the research? Are you going to like literally get that barley that you eat tested for nickel? Probably not. So it's safest to just assume in that situation, see if you can fix the issue. And then if you brought it back in and you know your daughter gets a cough or you get a skin issue or whatever, then you know. And then it doesn't matter what any app says. So what did Joe send me? Oh, there, he sent me the super chats. Sergio said, I got a stainless 18/8 for my kid's bottle. Is it okay? I'm going to say that if the only thing you put in a stainless steel bottle ever is cold water, cool water, cold water, like room temperature water, I'm not worried about that. I saw some people on the Reddit nickel allergy thing saying that they know somebody who works in a kitchen and they handle all sorts of stainless steel all day and they never react to it. I do think you should make sure you're buying quality stainless steel, like not like, okay, now I was thinking about it. I remember I bought one of those like generic type of Stanley cups from a Walmart. I don't know why I did it. Actually, I was with Kelsey. I was out of town, so I needed a water bottle. So I bought it, and I was always kind of sketchy on it. I was always like, I don't know what kind of quality that metal is on the inside of it. And when I got home, I kind of stopped using it. And now I'm not going to use that thing at all. I'm not using it. I have the Myo nozzle stainless steel bottle. Will I still potentially use that for a water bottle? Sure. However, I'm probably also going to buy a separate Myo nozzle and just put a straw in it and use it in a glass cup, because then I don't have to worry about anything. So I spend most of my day at home. I work from home. So then I don't need to use a water bottle. So I can minimize the stainless steel, but I can also, get the Myo nozzle effect. So I don't think if it's not acidic stuff being put into it and it's not being heated, stainless steel is probably okay, mainly if it's just water. But you also want to know if there's nickel in your water. Oh yeah, Sergio, Sorry you did the super chat. Well, thank you for doing the super chat twice, Sergio. I know that was important to you, but I again, if you guys want me to say that a certain food is okay or not, it all depends on what soil it was grown in. This is in the nickel literature. Like, I can't tell you what your location's nickel content of a certain food is. I can't. So I'm erring on the side of caution. And it's like, if it's a high soluble fiber food, which is what we ate a lot of, I'm skipping it. I'm not going to risk it during the first 3 months. And honestly, I never really. Here's a funny thing too. Those of you who were in the Black Oatster cult, which was a group of people in the Love Your Liver who were eating, they're still there, I'm sure, but they're eating like oats, overnight oats with charcoal in them. So it's water and charcoal and oats. And they seem to be doing really well. Maybe the charcoal was soaking up a lot of the nickel, whether it was in the cup itself or after they ate it. So that could have been, so it starts to make sense now why some people were doing so much better on, if they were taking the charcoal, let's say, because they thought the oat soluble fiber would cause a bile dump, yet what many of us have interpreted as bile dumps to this point, like let's say from soluble fiber, may simply be getting nickeled, then the charcoal helping makes sense. There's always a mechanism. We may not always know it, but when things start coming out we figure out mechanisms backwards. People want to figure out the mechanisms first. You watch what happens in the real world and then you figure out the mechanisms backwards. Okay. Okay, so JDS, so now that I got to all the super chats, I'm going to try to hit some of the early questions. So JDS asks, are hair tests reliable for nickel toxicity? At this point, if they get if the nickel on the hair test gets suppressed by consuming too much nickel, then they're not accurate in that way. It may be like we find out later after people eliminate nickel and then we see a spike and then we know that it was there. The typical stuff in the research, they actually they use urine levels to look for nickel, the amount of nickel that's coming out. Then we have blood. They actually showed that in people who were exposed to nickel, often their blood levels wouldn't change, but their urine would go up. So it seems that the urine is the like right here, right now indicator. Blood is not very useful, and hair testing may show it after the fact. So, Janice said, I certainly have scale psoriasis all over. I stopped doing oats and beans, I think like 3 weeks ago, had some whole wheat since, but I've been noticing skin has gotten worse lately. Well, I would make sure okay, so one other thing, folks. We've had this happen. I didn't pull up the research for this. Thiamine can bind to nickel. Obviously, flush niacin, when people were on high white rice diets, they got pellagra, they got B3 deficiency. So I'm going to, and one of the biggest things that I saw on people who are on a high oat diet, I did some AI searching because I wasn't going to look up all this stuff, but the biggest nutrient shift from somebody going from like I searched for two things, a high oat diet and switching to white rice, or a high oat diet and switching to lots of bananas. The biggest nutrient shift was B1. So then I went and I looked up, does B1 bind to thiamine? And I found a paper on B1 binding to thiamine. So B1 may be an antidote for stirred up nickel in the system. But we also know zinc helps with nickel, flush niacin helps with nickel. So I would definitely address those. You may still be, if you have scaly psoriasis all over, you may be quite nickel toxic. Obviously, Jana, I think I've talked. Yeah, we've talked. female. So we got more likely nickel toxicity and worse nickel toxicity. So yeah, it may just take, like I said, 2 to 4 weeks. And then, yeah, the gentleman who took out the oats and went to the white rice or the bananas, his skin got pretty bad pretty quick. And he went back to those foods and he went back to oats and it all went away. So if you need to suppress it a little, Jana, you could go back to some of it. But if you want to push through, then you can it will go away. I was amazed at how much it started lifting just for me, just like the other day. But remember, I'm a guy and I've been taking, 60 milligrams of zinc or basically 2 keystone minerals for a very long time, and the magnesium and all that stuff. So Christine Hoflick says there's nickel in makeup. Yes. Janice says, I thank the Lord that I never wore makeup more than 10 days out of the year, jewelry too. Yeah. So you ladies this is what what I was thinking about? I was thinking about kind of as women get older, they start doing more makeup and doing more hair stuff and wearing more jewelry and bracelets and all that stuff. And I was like, and oftentimes there seems to be a pattern of weight gain that goes along with that, and thyroid problems. And I'm just like, wow, they're just putting nickel all over themselves. Oh, Janice said, I bet she got most of hers out of tomato sauce cooked in steel pots. That will do it. The funny thing is I saw people on one cooking thing say, don't cook tomato sauce in cast iron, cook it in stainless steel. And I was like, no, don't do that. Buttercup Yeshua asked, if your wrist turned green, does that mean nickel in the jewelry? No, that means copper. Copper is the green, generally. Hilda says, I was wondering if grains and beans, which are stored in metal grain bins, are absorbing nickel that way too. If it's dry, I doubt it. I don't know how it would transfer. If it's dry, there would need to be water for it to transfer. Lynn said, if it's on you, it's in you. Yes. Janice said, I just got my permanent retainer out 4 weeks ago. Per the Revive episode with this nickel thing, I'm even happier about it. Damage was done over 15 years though. And so I just got a message from somebody who is doing the low nickel diet. And they said, everything hurts. It feels like I got hit by a truck. You remember the systemic inflammation thing I went over before? I have another woman who told me, who is low ferritin and low thyroid, who said that if she doesn't take enough zinc, she hurts all over. She has to take enough zinc so she doesn't just hurt all over. This is nickel. Oh, I have so many papers on so many different disease conditions. Like there's a whole paper on nickel and autoimmunity. There's a paper on higher nickel levels connected with arthritis. There's ADHD and nickel and autism and nickel. And nickel basically crushes your dopamine and your serotonin and your noradrenaline in your brain. Like this stuff is horrible. You want to do this. Like if you want to wait for testing, go ahead. That's fine. If you don't ever do a low nickel diet and you say, I'm not getting better on LYL, don't come to me because I already gave you an option. This is the option. So, let's see. Oh, they did say in one of the nickel studies, they said, some of the low nickel papers, the low nickel diets, the European ones, they said, don't eat canned foods. They said, don't eat canned beverages. And they said, do not eat food cooked in or stored in iron containers. Now that's not nickel, but that's what they said. No canned foods, no canned beverages, and don't eat food cooked in or stored in an iron container. So, Buttercup Yeshua asks, how do you tell if your cookware has nickel? Did someone say in the last chat that if you put a magnet to it and it sticks, that means that there's nickel? Kelsey knows that one. I don't remember. which one it was. Let's see. Let's see. Blaze Becker says, if it says 18/0, there is no nickel. Yes, 18/0 stainless steel. Also, because there's no nickel, it tends to corrode very quickly. And I don't want corroding nickel in my stuff either. Oh, there's Beth. I see Beth. I see your heart. Thank you. Actually, Beth was one of the ones who was messaging me, and she was like, to paraphrase Beth, she was like, I'm not doing so hot on this low nickel diet. And I was like, and at the time I didn't know about the nickel dumping. And I was like, I said, are you under eating? I think she said she might be under eating, but now I'm just like, oh yeah, it's the dump. It's the dump. Let's see. Wait, stop doing that. Okay, Buttercup Yeshua said, guess who has major nickel toxicity? All our tattoo friends. Poor guys, I heard once you get a lot of them, their health goes down. Folks, don't get tattoos. You're literally putting heavy metals in your skin that, by definition, they cannot be detoxed. You understand? Your tattoo would disappear if you could detox them. You're literally putting heavy metals in your skin that your body cannot detox. So they are just constantly, your immune system, which is your cleanup crew, is constantly trying to attack them to get them out, but they can't get to it. Don't get tattoos. Hold on. What time is it at? Okay. Somebody in the chat asked, is charcoal safe for dogs? Ask a vet. I'm not a vet, but it should be fine. There's actually stories of monkeys eating the charcoal after a forest fire. Like they use it as medicine. And a person said, my nickel symptom was just fatigue. That's fine. I don't know why. Oh, there we go. Okay. So Janice said, my psoriasis exploded after doing vitamin A supplements. Well, if you know it's a vitamin A problem, then yes. Been trying to get it better, but zinc has been hard for me to tolerate. Slowly building up tolerance, maybe reducing nickel will help. I think it will. I think it really will. Sergio said, I can take 50 milligrams of zinc picolinate, no problem for me, but at the start, you would get bad copper symptoms. Yeah, what copper or nickel, we just don't know anymore. Oh yeah, so that would be okay. That's a good point. Jana was saying, okay, so you remember how we were just talking about the water sitting in the pipes overnight, and you want to flush it, right? That makes sense. Okay. Jana was pointing out, talking about a water bottle. If the water's sitting there a good while, the nickel will leach. I understand this can happen to water sitting in your house pipes overnight. So that makes sense. So a lot of us, I mean, okay, I'll be honest, I'm kind of lazy with my water bottle. I don't wash it that often. Because it's sealed and I only put water in it. I put water after water after water in it, and I'm it's the Myo nozzle, so there's not going to be like backwash. And I just don't care to wash it that much. And now I'm going, that water that just sits in there, especially if, let's say, I don't know, I leave my water bottle in the car in Tucson in the summer and it hits 130 or 140 degrees. And then you got a plastic straw and a stainless steel bottle. This is why, could that be a nickel problem? Whereas somebody who puts fresh, cold water in it daily and dumps it out at the end of the day isn't a problem. This is why, like, these judgment calls, we kind of just have to make choices. And I think erring on the side of caution is the better choice. So do you have to get rid of all your stainless steel water bottles? No, but I would definitely only use cold water in them, and I would dump it out each day, or dump it out before you fill it again. Don't drink the water that's been sitting in there. Okay. Oh, Sergio's saying she's afraid she'll break a glass bottle. She's only 5 years old, and you change the water every day. Well, good. I'm glad you change the water every day. And yeah, those kids with things, they break them. They do. Buttercup said the bots are after me. I mean, it's yeah, you can get, yes, Buttercup Yeshua said you can get those glass bottles with the rubber, the silicone on the outside, so they're a bit more drop proof. Blaze said saliva will leach the nickel if you're not using a straw. Just minimize where you can. That's a good general thing. Hilda Margaret said I had high vanadium levels on my tests, also very conductive and often used in an alloy with nickel. What I can tell you is that normally as we do the program, we watch vanadium and chromium, which move up and down together on a hair test. Not everybody knows that, but vanadium and chromium tend to move up and down similarly. Those go down. We normally see those go down as we do this. So, oh, here, Rebecca Oliver said, I started last week with the low nickel diet, dumping like crazy, all sorts of symptoms, hoping this is the answer to my lingering issues. Thank you for figuring this out and sharing. Thank you for sharing that, Rebecca. I was hesitant. I mean, really, folks, like my buddy Edison and I, we started the low nickel diet. Like I started it maybe 4 or 5 days before him. I know he's a lot more toxic than I am. And we text a lot. And we kept getting symptoms at the same time of the day. And I was like, it's gotta be space weather. But I was sitting there going, why is this happening so often? And why are we at the same time? Well, then I think about the nickel and space weather. And I was cheerleading myself going, if I'm right, this will end. And my space weather sensitivity will greatly decrease or go away. And you know what's happened in the last couple of days? He's still having some what look like space weather flares. And he doesn't normally have GERD, but he's got GERD. And he's like, when is this going to go away? And I'm like, dude, it's going to go away. But so he's still having a rough time, but he's feeling like it's starting to come. He's coming out of it. And I'm like 2 or 3 days moving out of it. And I'm looking at some of the space weather stuff I'm checking to see. I'm like, is this really happening? And it seems to really be happening. So if you're sensitive to space weather, I would do the low nickel diet. If you're sensitive to EMF, I would do the low nickel diet, the low copper, low nickel, all that stuff. And then we're going to have special guest, Sarah Leilani. It's Sarah Leilani. It's not Sarah Viao anymore, but it's Sarah Leilani. She's our EMF solutions person. And they've been figuring out the new fiber optic EMF problem. And then we may have figured out how to fix the internal biochemical EMF space weather problem. I'm really excited for this because like my buddy Edis was still having symptoms. They're getting better, but he was still having them. And I came out of it and I went, we were like synced in terms of when the symptoms would happen for like a week and a half or two. And it was starting to get kind of weird. And we were kind of looking around going, why isn't this affecting everybody else? And now we're coming out of it. And you can see I'm happy as a clam. Like I'm super excited about this for all of you guys. I mean, myself, of course, like I got into this to help myself. And then I just spread it to everybody else. So, okay. Shanjack asks, L-histidine might clean up nickel. Maybe. I don't know. It's in there. I think it binds to albumin and histidine and whatever. I'm histidine in my real world experience. Histidine, it's supposed to bind to copper too. It was one of the most nonplussed, like the most non-performing supplements I've ever taken and had other people take. It didn't help anything. that I noticed. So if you want to try it, you can. But again, the key thing is to get your internal nickel levels down so that your immune system stops overly freaking out about it. Your immune system is like hyper reactive and hyper vigilant to nickel if you've got an issue with it. So the key thing is to take that away so like your your immune system can like de-traumatize itself. That's basically it. That's why some people get people could be nickel toxic and some of them get the skin reaction and some of them don't, because some people's immune system at their skin is not hyper reactive to it, but it's still toxic and it's still affecting people. So, hold on. Does anyone have the source document for activated charcoal being safe for dogs? I've never seen that. I don't know. That might be a question to ask AI and ask it for the references. Ask it to give you the links. I would do that. Yeah, Janice said, so removing my retainer. Yeah, so removing my retainer and stopping the oats and beans drove up a nickel detox for me, perhaps, but then it would potentially go away in 2-ish months. Yeah. I mean, but you can try to do things along the way, the zeolite and the charcoal and the niacin and MSG. Kelsey's going to assemble the literature on glutamates. We have another paper on polyglutamic acid, so multiple glutamates bound together helping with nickel. I think she's got a study on another glutamate study on helping with nickel. Like MSG is probably helping with nickel. And so for those of you who are like hypersensitive to nickel, I mean, to MSG, again, that could be a nickel problem and it's just showing up that way. Okay. Buttercup Yeshua asks, is rice low nickel? White rice is low nickel. Brown rice is not assumed to be low nickel. So basically whole grain. So brown rice would be the whole grain version. White rice would be the refined version. So refined flours, white rice, potatoes. That's the short list of starches. Tapioca, if you're into that. Yeah. So Buttercup Yeshua, you got the whole food list in there. Let's see. Let's see. Oh, we got some. Oh, yeah. You know what was funny is, again, with the nickel thing, makes you reconsider the whole artist's nicotine tobacco push. We got another factor in the infertility psyop. So let's see. Buttercup Yeshua said, vapors, God bless them. Please save the vapors. Like, oh, the vaping. I mean, I remember with, I remember when, I went to a bachelor party long time ago where there was like vaping going on a little bit. And back then, like that's like back when I was doing CrossFit in 2005. Like it was still cool and new back then. Like back when vaping was still kind of cool and new, it was like, oh yeah, we could actually go into a nightclub and smoke in the nightclub and nobody cares. And anyway. And now I just go, that was dumb. I mean, vaping is like specifically made so you can become absolutely, completely addicted to it. Let's see. Buttercup Yeshua said, I used to work outside on the ramp at the airport. When I quit, I detoxed for a year. Black stuff came out in my spit. Don't run on busy roads. Like, don't. Air pollution is real. Your lungs are designed to absorb things. If you put toxins in your lungs, they absorb them and they hold on to them until you can get rid of them. Okay, let's do another example about the nickel. You might have to stop taking in the nickel before you start detoxing and it shows up on the hair test. Well, we know people like who smoke, they stop smoking and they start finally coughing up a bunch of stuff. They might have been coughing up some stuff before, but when they stop smoking, they really start coughing up. Buttercup Yeshua worked on a ramp at an airport, coughed up black stuff for a year afterwards, but he had to stop working before that really started. So again, we have to stop intoxing before we start detoxing. And this nickel thing seems to really hit heavy when you start getting not enough of it in your diet. Like when you start getting less of it past a certain threshold in your diet. Oh, wow. It's almost 3:00. Okay. Whew, I knew this was going to be a big one. We got some fun people who showed up in the chat today. Okay, Eliza says in England, older houses actually have stagnant water stored in the attic. So second floor bathroom is actually much different than the lower floor. Yeah, I think we got some bots today. I think the bots are coming out after the nickel stuff. Oh yeah, is nickel or beef better? Yeah, these guys, this is fun. I want you folks to realize what this means. We're literally getting either trolls, a synchronized troll attack, or bots coming after the nickel stuff. So how important does that mean this is? Why is nobody talking about it when I can find all that research on it? Why aren't the influencers talking about it? That creatine push, now it's really starting to come out. Go type in creatine and nanoparticles. That 20-gram creatine push. When you're seeing people selling this crap everywhere, influencers pushing it everywhere. Remember methylene blue? 20 grams of creatine a day, bro. It'll protect your brain. No. And then they have bots everywhere saying it's the safest supplement ever studied. No, there's a push. There's a reason. They don't want your brain to be good. Like if you're not here and you don't understand that much theory, you're in the wrong place. Like we're not here to go with the mainstream and be like, but Joe Rogan said, okay, no, sorry, go somewhere else. Go bot somewhere else. Okay. Janice says hot lava shower, guilty as charged. Ladies, you do a lot of this to yourself, ladies. At least you're here to fix it. Hamza asks, can tap water be high in nickel? Yes, absolutely. What about iron overload? I mean, we're still going to fix iron overload. I think iron overload could be related to nickel in terms of both high and low, like high iron and low iron. Yes. Okay, Baptism Fires. Okay, I want to go over this. Baptism Fire said apple pectin helps me better than charcoal even. I may do a whole show. I'm actually considering, I'm going to get a quote on making apple pectin capsules myself. The research on apple pectin and health issues is outrageous. Like I just don't find myself ever eating apples. I like them, but I just don't ever like really choose to pick one up and eat it. But the apple pectin capsules, I think I'm doing about 9 apple pectin capsules a day right now. And it feels good. And so again, Apples have a lot of malic acid. Apples have pectin. Apples have been shown to be the healthiest fruit in the research, bar none. Nothing else compares. Malic acid, pectin. There's always a reason. So I highly suggest trying apple pectin first. Can you get a powder? Yes. I'm going to tell you, I don't know what somebody meant, but they said Nutricost was really behind the big creatine push, or something in their creatine product was really sus about it. And I'm going, I don't know about Nutricost anymore, but they do make an apple pectin powder, which, Anyway, I think apple pectin capsules, if you're doing this, would be a great choice, and don't go easy on them. Don't hold back on them during the low nickel diet. This doesn't have to be forever, remember. Okay. Okay. Let me just hit on this last one. XX MLG CPT MT says, just got here, not sure if answered yet. Is psyllium still okay? Since it's made from a seed, I have a feeling it might not be. Here are my concerns about psyllium at this moment. It nearly all comes from India. So for a lot of you, hopefully that raises some red flags. Like, it's all grown in India. There has been, go and research psyllium and lead. And then we get into, could there be nickel in it? I'll be honest, I don't like the taste of psyllium anymore, and I'm done with it. You can do whatever you want. You can look it up on Nickel Navigator. You can research the lead thing. You can say it's racist to say that because it's grown in India, it might have toxicity issues other than the ones we know about. Whatever. I'm done with psyllium. I don't see any need to keep it. And it is a whole food fiber, a whole food soluble fiber, and the other whole food soluble fibers are the ones that tend to have the most issues. So I am personally done with psyllium. That's why it wasn't on the list. He said he buys a pound a week of pectin. That's something. That's a lot. But that just goes to show that if you're taking a pound a week of pectin, you would think that would cause a bile dump, but it's basically nickel free. So then it may not be causing issues. You're pooping pretty well on that amount of pectin, I guess. Pooping like a champion. So let me see. But yeah, I think we got to wrap this up. Okay, Joe, we're going to wrap this up. I got plenty of stuff to talk about, and we're still going to be waiting to see whoever, what the results of the detox dumping are in people as they decide to do this. Like, again, you can walk into this slowly. You can take out the whole grains and the oat and the beans at piece by piece, or you can just dive in. But the diving in can be rough, as we've had people here say, and I've experienced, and my buddy experienced, and Kelsey's experiencing right now. So yeah. Okay. So, Joe posted that link. So search engine. So this is a search engine. If you have anything you want to look up in our videos, you can just type in, this is somebody, I need to know this person's name. I always forget it. As in it mutates DNA agents. Well, in particular, when applied in combination with chemical mutagens. So synergistic toxins. I don't know, like we got another video playing in the background. EDTA. Where is that coming from? Anyway, okay. Live shows, right? Okay. So the transcripts, if you want to search all the live streams and all the YouTube videos for any term, a wonderful gentleman who was in the Love Your Liver program made that web page. It's a search engine, and he uploads all the transcripts there so you can search for any topic you want. That's down in the info box. It's always there. Okay. Oh, Joe says Robert C. Robert, let me make sure I got that right, Joe. Robert C. Yes. So Joe, let's go to the next one. Thank you, Robert C., for doing that. Oh, I can feel that these 4-hour live streams. I think 4 hours is about my limit. Joe, we're going to do the next link. So for those of you who don't know, if I did the Love Your Liver live stream on nickel toxicity and connected it to the top 10 causes of the deaths in the US in 2024 last week. So if you want to see the data on like, is this bad for people? That's there. So that's my Twitter link, x.com at NutriDetect. I do post reels there and we repost there. But yeah, I'm not super active there. So if you try to DM me there, I don't know when I'm going to get to it. Rumble. This is our Rumble channel. This is where you can find all of our videos unedited, without the missing one that is not here on YouTube. So you can always go to Rumble and find all the episodes, and we didn't have to make them nice for the Gestapo. So nutritiondetective.com. This is our main website. This is where you can find our supplements, the ones I went over today in that document about that can help with nickel toxicity. This is where you can find testing and consultation packages with Kelsey and Nathan, and you can get hair testing and blood testing. We'll probably make a nickel testing package available soon. And then, yeah, you can also find our the Love Your Liver program there too. You can find the link to that. Scheduling a consultation. This is the testing and consultation link. This is how you would work with us. And about the we are changing the office hours arrangement. It's not going to be included in the packages soon. If you would like to get 6 months of office hours access, listen to me carefully. I'm going to make another video on this, but if you want the 6 hours of office hours access, which is Kelsey and me and Nathan each doing a session each week where we take questions in a small group format in Zoom. If you want that, the last 6 months, you need to be scheduled on our schedule. Understand what I'm saying here? On the schedule before May 31st. Okay, so that just means you need to have made your appointment for whenever that's coming before May 31st. Do you understand? You have to pick your appointment date. So it could be November, but that appointment needs to be made before May 31st. Okay. Hopefully, people tell me they can't. And after that, what it's doing is it's turning into a membership thing. So if people want the office hours, they can get the office hours and they can subscribe to that. And there's going to be a fee for it. And if they don't want the office hours, they don't have to get it. So if you want support, it's there. If you don't, it's not. And you don't have to pay for it. So that's going to be the big change in the office hours. This is, if you want to get more information on the toxic bile paradigm, which may be shifting based on some of this new information, because we shift with new information. That's one of the things that intelligent and ethical people do. Anyway, toxic bile paradigm. That's the series I did with Beth. There's a 3-part series. Check that out. All the principles still stay. The Revive mouthguard, like I said earlier, I've moved up to the extra large R3. It's a big boy. I would watch the Revive episodes I did, the one I did with Ken Lever, and the other one I did on cranial structural changes due to toxicities and deficiencies. So it's not just because you got braces that your skull is the wrong shape or your palate's small or any of that stuff. So yeah, this is the supplements. If you are interested in getting the supplements we've talked about today, that's the link for that. I have the basic link to the shop in that document, so you can always find it there too and just click on that. then there is, if you join the Love Your Liver program, you can get access to the VIP store and get special discounts that only Love Your Liver members get. This is the link to the Home Chef nickel-free cookware. It's beautiful stuff, and it supposedly heats up faster than typical stainless steel. So it's 21/0. So there's 0 nickel in it, and it's apparently, I mean, you can go read the reviews on Amazon. It's great stuff. So what's next, Joe? Anything else?
Well, I just wanted to say to put the I put that link in the chat so they can click on it, because don't you get some credit, or if you sell 3 of these things by the end of the month or something. Is that the link?
Yeah. I think that's the link. Either way, to stay in the Amazon Associates program, because a lot of people you guys want me to have a list. Like, I don't care about getting 1% from Amazon, but a lot of people want me to have a list, and to maintain that, to keep the list going, and to do that, you have to get like 3 to have an Amazon Associates account, and to keep it going, I just need like 3 purchases in the first month. But I think we probably got that last week. Oh, but then they kicked me out again because I didn't do the right things again. So anyway, such a pain in the butt. It's funny. I watched the episode on South Park with Jeff Bezos with the blood vessels in his head and the telepathy and all that stuff. That was a funny episode. So, Instagram, yes, the.real nutrition detective. I post reels there mainly. Check it out if you like. And then we have Substack, Dr. Garrett Smith at substack.com. We post some stuff there. I haven't gotten around the time to write big stuff there yet. So nickel, this is the episode. This is the nickel toxicity episode. Symptoms, detox, diet, and the hidden sources, as in air, water, and food. This is episode 246 without missing a week. Hope you all enjoyed it. Hope you have plenty to work with. Don't hyperventilate. It's a phase. It's a phase. But just remember, if you dive in, the harder, the bigger they are, the harder they fall. The more you dive in, the more potential for detox symptoms. If you want to walk it in, then walk it. And if you don't want to do it at all, that's fine. And if you want to stop it at any point and go back to eating what you were before, then that's fine. You just got to get through it at some point if you really want to fix the nickel thing. And I'll show all the research connecting nickel to all these conditions next week. So anyway, I'm Dr. Garrett Smith. Thank you for joining me. You Inner Circle folks who are on after this, I'm not going to get to it today, I don't think. I'm going to have to reschedule it because this was another... Joe had something he had to take care of, and I'm doing another 4-hour episode. So things happen. Anyway, we will see you all next week. I'll be in Idaho again. So have a great week. Bye now.